Wow. This test of physical.
Cardio కదా ఫస్ట్
Cardio.
ఇది కూడా
It is.
ఇది రెడీగా ఉంది.
Okay. Just clear it. Right?
రెడీగా ఉంది రెడీగా ఉంది.
Okay. Just introduction itself.
ఓకే ఇది కూడా పనిచేస్తుంది పాయింట్. నెక్స్ట్ స్లైడ్ కి అది ఇది కాదు పాయింట్ ఇక్కడ
ఇది ఇదే ఉన్నాయి. Highlight introduction. Slideshow petition. Right? Right. Good morning, ladies and gentlemen. Today we have with us Dr. Kalajitendra Jain, sir, Senior Consultant Cardiologist, practicing at Yashoda Hospital, High Tech City. Today, I take a privilege to introduce sir. Today he is here to give a brief discussion about the heart strokes, how does it occur, causes, symptoms, and what kind of preventive measures have to be taken, early detection and all. So I highly invite Dr. Jitendra Jain, sir, to come to the stage and give his suggestions. Please.
Just the slides move here.
Yeah.
Okay, then it's easy rather than starting.
Right.
We have a column next.
This way, no?
In the column. Yeah, that's easy for me. Yeah. Hello. Yeah.
Yeah.
And there's the next one. There's the previous slide. Yeah,
There's
there's
the
the
next
point. Right. So very good morning, everyone. Sorry for the delay, in Hyderabad, traveling from one place, coming out and spending the time from the hospital is really a tough job for us. So I think I thank Nabij Singh Sab for inviting me, as today's talk for, especially, in today's arena, the importance of health. I think everyone knows what heart health is and why is it important. So we have seen that, before COVID, I think the era has been divided now after the COVID time into a pre-COVID era and a post-COVID era. So pre-COVID, if you take, we used to treat a lot of patients. So previously I was working in Nizams, where I was a faculty there. I was a professor there in the Department of Cardiology. So we used to treat a lot of cardiac patients. A lot of patients used to come, we used to do angiograms, we used to do angioplasties for blockages. But the age of the patient was really different. So always most of the patients, they used to be in the 30s and 40s, 50s, not 30s and 40s, 50s and above. But after the COVID, the whole, the spectrum of disease has changed. So the age now we see more and more of younger patients. So which we never would have imagined. So previously, whenever a young patient, young chap, whenever they used to come to the OP for consultation, for chest pain or something, we used to just take an ECG and say that nothing is there, you just go home. It's more of not heart-related pain, nothing is there. But nowadays, after the COVID time, even a small type of pain or any a pain which is on left hand pain or any back pain, any discomfort from the normal, we don't send the patient. Because there are so many cases which we have seen after COVID, where we think it as non-cardiac, we send them home, and after time we hear them that to some of their relatives and so on, that the patient is no more. So the question is, a lot of MIs, a lot of heart attacks have been happening, and I don't know exactly the reason why the heart attacks are increasing, after the COVID era. So that is the motive, we had a discussion that, we just need to understand. So I'm not here to give a, clear-cut discussion about all the slides, what is, heart attacks, how does it occur, how do we do angiograms and angioplasty or not. So my main motto of taking this talk is to make you understand what do you mean by heart attack, what are the symptoms. So basic symptoms of heart attack. So when we need to be alert, and when we need to take a consultation to a cardiologist or a physician for ourselves and for our family members. Our responsibility being a citizen, we always have our aging parents who have a lot of comorbidities like diabetes, hypertension, and so on. So many people may not be knowing that they have a heart disease. Suddenly, when time comes bad, like having any chest pain or something, you have to rush to the hospital, and then you got the treatment. And sometimes you may save your beloved ones, or sometimes you may not. So that is why the importance of screening comes into picture. You understood? So how many of you, please raise your hands, like you get your father's or parents' health checkup yearly? One, two, three. So I think almost, 1/6, 1/7, 1/8, I think probably. So almost, I think 50 members are there here in the hall, right? So among 50, I think 10% of the people are, we check our parents. How many of you check yourself every yearly? Or twice yearly? Take it not 1 year, twice yearly. Sorry, 2 times yearly. I mean to say every 2 years or 3 years. 1, 2. No. So all are in their 30s and 40s. Right, sir? I think most of them are young. Right. So that is where, the importance of health comes into picture. Like what I said, we being 37 years, kya hota hai? I think all of comfortable in Hindi and Telugu. Telugu kuda comfortable? Right. So, చాలా మంది ఏంటంటే నాకు 30 సంవత్సరాలు 40 సంవత్సరాలు ఉంది, నాకెందుకు చెకప్స్ డాక్టర్ గారు, బాగున్నాను, ఒకేషనల్ గా స్మోక్ చేస్తాను, ఎప్పుడో ఒకసారి మందు తాగుతాను. So why you need to have a health checkup? So that is the common trend, which mindset which we have, actually speaking. But on the contrary, if you are 30, 35 plus, you should always get your health check started. Why? Because many of the diseases, whether it is heart related or non heart related, it could be cancers. Many of the cancers are detected later in the stage. Like you see, some of parents also, they come late in the stage, like with breast cancer or cervical cancer. By the time you diagnose, they are in stage 4. అప్పుడు మీరు ఎంత డబ్బులు పెట్టుకున్నా, ఏం చేసుకున్నా, whatever the treatment, you go with bigger hospital like Yashoda also, you won't get the proper treatment because the stage is gone. The stage where you want to give best treatment, the time we give chemotherapy or radiotherapy or whatever the treatment strategy, that time is gone, and the lifespan will be around 3 to 6 months. So that is where the importance of health check comes into picture. So screening ante not only heart, like cancers, checking for sugars, BP, thyroid, all these are the basic things. So why is it important? Why is screening of sugar and BP is important? Because if you diagnose it at the early stage, అంటే షుగర్ ఉందని ఎర్లీ స్టేజ్ తెలిస్తే మనం దాన్ని కంట్రోల్ చేసుకున్నట్లయితే మనం దాన్ని ఒక కాంప్లికేషన్స్ ని అవాయిడ్ చేయొచ్చు. హార్ట్ అటాక్స్ కావచ్చు, బ్రెయిన్ స్ట్రోక్స్ కావచ్చు, ఏదైనా కావచ్చు. సో అందుకనే ఎవ్రీ ఇయర్ అట్లీస్ట్ వన్స్ వాట్ ఐ రికమెండ్ ఇస్ యూ షుడ్ గెట్ యువర్ హెల్త్ చెక్ స్టార్ట్. So that is what I wanted to just inform before I start my presentation. So coming to this, our hospital, it is Yashoda is one of the biggest center. It is I work as a senior consultant at High-Tech City. We have all the specialties starting from transplant teams. Yesterday only we had a heart transplant done. So the first heart transplant done at High-Tech City. We have other branches also where it was being done. So cardiac transplant was being done. So bone marrow is being done, lung transplants are being done. So all the facilities are being done at our center. So it is like not a tertiary center, but like a quaternary center. So coming to the important slide, I just wanted to understand the slide. So please go through this. These are the common questions, which I face routinely in my practice, being a cardiologist. The first one you can see, what do you mean by heart attack? So what do you mean by heart stroke? అంటే చాలా మంది యూట్యూబ్ వీడియోస్ చూస్తూ ఉంటారు, తెలిసే ఉంటుంది చాలా మందికి. జస్ట్ టు అండర్స్టాండ్ వాట్ యూ మీన్ బై ఎగ్జాక్ట్. సో కెన్ సమ్మన్ వాలంటీర్ అండ్ టెల్ మీ వాట్ యూ మీన్ బై హార్ట్ అటాక్? సో హౌ మెనీ ఆఫ్ యూ నో వాట్ ఈస్ బేసికలీ ఇస్ హార్ట్ అటాక్? हिंदी भी है, ओके, राइट. So heart attack क्या होता है, मतलब what do you mean by heart attack? So anyone can want to, I think madam is a doctor, so I can exclude her from this. So anyone, yourself sir? Yeah. So blockage in the heart. So whatever the vessels which supply the heart, so if you see, I'll just show you one of the slide. So this is an interesting slide where you see the arteries which supply the heart. So this is the normal artery which is there in your most of the persons who don't smoke, who don't take alcohol. You see the white, which means it is clear, there are no blockages. But once you start, having an unhealthy lifestyle. So what do you mean by unhealthy lifestyle? Unhealthy lifestyle means smoking, which is one of the most common thing, which many people see like, it's a pleasure, it's, to reduce stress at a, at a job stress environment, like so on. So smoking is one of the strongest risk factor which we see in the 30s who suffer with heart attacks. So many people, they smoke almost, 1 or 2 packs of cigarette. They say, doctor, only 1 or 2 packs, that is okay for us. That is sufficient from morning to evening. And that will help me relieve and get my job done. But the problem is that smoking will cause you all the cholesterol deposits, all the inflammation here, and it slowly goes on increasing, and it ultimately leads to a total blockage of the vessel. So when it gets totally blocked, the blood supply to the heart stops, and the patient will have heart attack symptoms. So heart attack symptoms, I think everyone knows. So what are the symptoms of heart attack? Can anyone, sir? I think you are yourself. Yes, uneasiness in the chest, sweating, pain. So these are the common, everyone knows. Like whenever you have a chest pain or here, अरे भाई कुछ तो गला गड़बड़ हो रहा है, कुछ तो तकलीफ है. We'll go to a doctor, we'll take an ECG. But there are certain symptoms which you don't know it is a heart attack. Like बर्निंग सेंसेशन. बहुत से बार अपन एक दिन पहले पार्टी को जाते हैं या कुछ कॉर्पोरेट फंक्शन होता है, देन यू हैव सम बिरयानी और समथिंग, इन द नाइट यू फील सम अनईजीनेस. बहुत से लोग अपन, अरे यार बर्निंग सेंसेशन है, कुछ नहीं है, रात में कुछ खाया या कुछ, वी हैड सम स्मॉल ग्लास ऑफ वाइन पी लिया, तो उस टाइम पे रात में तकलीफ हुआ है, तो सुबह तक कम हो जाएगा. वी टेक सम एसिडिटी एंड समटाइम्स वी नेग्लेक्ट द सिम्टम्स. सो मेनी टाइम वी सी यंग पेशेंट्स हु कम टू द हॉस्पिटल विद इमरजेंसी with this burning sensation only. Or when we take an ECG, we see it's a clear-cut heart attack sign. अगर अपन बैकग्राउंड देखते हैं तो that's only a coincidence कि उसने बिरयानी खाया है या उसने अल्कोहल पिया है, but that is not the exact reason for his pain. So until unless you take an ECG, you will not understand it is a heart attack. So the most common masquerading symptom बताते हैं, मतलब burning the chest, you should never neglect it. At the same time, pain in the left hand. अगर लेफ्ट हैंड में पेन हो रहा है, बैक में पेन हो रहा है, स्वेटिंग्स हो रहा है, then that is one of the common sign of heart attack. So you should always don't get panic at the time. You should immediately rush to a nearby ECG center, wherever you have near a diagnostic center. Get an ECG done. तो वहां पे जो भी फिजिशियन है वो दिखा देगा कि उसमें हार्ट अटैक के साइंस है नहीं है, then let's do okay. You will give some antacids, it may come down, but don't take antacid by yourself. That's the most important thing. So why? Because जो time होता है 6 घंटे का जो time रहता है, if you reach within 6 hours of time, once you get the pain or once you get the symptom, the chance of recovery is very high. जितना लेट करोगे hospital जाने, by the time you reach a hospital, your BP may go down. So because of the heart attack, the BP may go down. You may not be conscious. By the time they reach, they'll be on almost cardiac arrest, and you cannot save them. So that is why early going to the hospital is one of the most common thing which everyone wants to understand. That is called as golden time. That 6 hours of time is called as a golden time. So that thing you need to remember. So this is where, the reason for the heart attack, like I said, when there is a 100% blockage, it is heart attack. So what are the common risk factors? क्यों आता है? So one is, I'll show you one slide which is a very interesting one. So what are the causes? So these are some of the reasons why you get heart attacks. Risk factors बोलते हैं, मतलब जिसको ज्यादा risk factors रहेंगे उनको ज्यादा chances है कि heart attack आने के chances है. So risk factors is थोड़े modify कर सकते हैं, थोड़े modify नहीं कर सकते हैं. So non-modifiable like age. जैसा age बढ़ेगा heart attack मतलब 50-60 को chances ज्यादा रहते हैं 30-40 से. Male gender. So the problem is God has given such a discrepancy or a bias that females are protected from heart attacks. That is not a myth. It is a fact. यहाँ पे जो भी लेडी फीमेल्स बैठे हैं, I think God has given you, a good, a hormonal milieu where the chance of attack are less common when compared to males. बेचारा लड़कियों को हर जगह मतलब हॉस्पिटल ऑफिस में भी तकलीफ है, घर पे भी तकलीफ है, कहीं भी जाओ, always eat at risk at many situations. Whereas for females, I think because of the hormonal milieu, that is why reasons females have less heart attacks. Yes, excellent. So because of the estrogen and the progesterone. So जब तक estrogen progesterone चलेगा blood में, तब तक the chances are less. ऐसा नहीं कि नहीं आएगा, ऐसा कुछ नहीं. जिसको शुगर है, जिसको बीपी है, जिसको फैमिली हिस्ट्री है, उसको आने के चांसेस होते हैं. But up to the age of 50, till the menopause is reached, then till that time they are protected from heart related issues. So after 50, then the risk of males and females are the same. तब दोनों एक ही मतलब एक ही रिस्क में आ जाएंगे, मतलब both are equally getting the chance of this thing. The third one is family history. Family history क्यों? Suppose आपके फैमिली में पिताजी को या दादाजी को किसी को भी हार्ट का प्रॉब्लम है, then the chance of getting to the siblings is very high. मतलब एक भाई को है तो दूसरे भाई को भी आने के चांसेस ज्यादा है. चाहे वो स्मोक करो या मत करो या कोई रिस्क है या कुछ भी नहीं है, but still the family history is stronger. I'll tell you one example. एक फैमिली है, I think from my place, last 3 years back, I treated 4 of the family members, all siblings. First was an elderly sister, second was 2 brothers, and the fourth one was the last youngest one. So all the 4 had heart attacks in a span of 2 years. मतलब 2 साल में चारों इमरजेंसी में आए थे. The interesting point was, first को इमरजेंसी में हमारे गांव से दे शिफ्टेड बिकॉज ऑफ द चेस्ट पेन, जो दर्द आया था, तब इमरजेंसी में मैंने हार्ट अटैक उनको ट्रीटमेंट किया. उस टाइम पे उनके दूसरे तीनों भाई और बहन भी दे केम टू मी ड्यूरिंग मीटिंग देम इन द हॉस्पिटल और सो ऑन. एट दैट टाइम आई हैड ए डिस्कशन विद देम कि ऐसा हार्ट अटैक आया है, आपके भाई को, आपके बहन को ऐसा हुआ, ऐसा है. देन आई आस्क्ड देम जस्ट कैजुअली कि आपको भी कुछ रिस्क फैक्टर्स है? डॉक्टर साहब मेरे को कुछ नहीं, आई डोंट हैव शुगर, आई डोंट हैव बीपी, मेरा एज 55-60 है, मैं एक्टिव हूँ, मैं मेरा काम करता हूँ, आई डोंट हैव एनी प्रॉब्लम. देन आई सेड गेट योरसेल्फ चेक्ड. दिस से डॉक्टर साहब में हम आएंगे, अभी थोड़ा बिजी है, हॉस्पिटल का मतलब ऑफिस का काम है, 3 महीने के बाद. सो आफ्टर 3 months द सेकंड पर्सन केम इन एन इमरजेंसी. The question, you understood? The problem was they didn't get screened at that point of time, which was a golden time, and they lost the operation. The same thing happened for the third one also. Luckily, the fourth person, they came to me OPD seeing all the risk factors. He got the TMT done, and the TMT was positive. So I did an angiogram and then did an angioplasty for him. So the question is, the fourth one was little, skeptical, seeing all the things. So why I'm saying the story of this is, if family history को कोई change नहीं कर सकता. We don't have any medications. We don't have anything to change the genetic background. So each person having a heart disease in the family, always the other person should screen yourself. So you should go to a physician, you should go for the diabetic checking, hypertensive, and all those things. Heart related things also you need to check it out. So metabolic risk factors, like I said, जिसको बीपी है, जिसको कोलेस्ट्रॉल है, जिसको शुगर है, उनको हार्ट के अटैक करने के चांसेस ज्यादा रहते हैं. तो यहाँ पे किसी को बीपी ज्यादा है यहाँ पे? Anyone has a hypertension here? Anyone? Please volunteer. It's nothing like under control with medications. Okay, so you went for a routine screening or how? Okay.
I was all fine, I thought, so I withdrew the medication 1 year back. I went for a normal lung checkup and they found there is a lesion in the retina.
Okay.
Changes.
Changes.
As well as there was avascular area because of, I think, the blood vessel was cut off. And aneurysm.
You're a medical, madam?
Veterinary.
Okay, excellent. Because you're using medical terminology, that's what, yeah.
But could be triggered by BP is what.
Right.
I have little hyperlipidemia and
BP.
on medication right now and all fine. So in this, I also had a question. Does the retinal health indirectly talk about the cardiac health also?
Yes. Very good example. I think what madam is pointing out is Until we go and check yourself BP, many people will not know that you will have hypertension. सबको नहीं पता चलता है कि मेरे को BP है, because BP most of the time is a silent killer. Both BP and sugar, if you say, they are the silent killers. आप check नहीं कराएंगे तो आपको मालूम नहीं पड़ेगा कि आपको BP है. So almost दुनिया में, if you take the world statistics, 1/4 of the persons they don't get checked at all, even though they have a hypertension. And among them, 50% of the patients, even though are diagnosed with hypertension, they don't take medicines. I think like madam is saying, you have taken medications, but बहुत से बार कहते हैं डॉक्टर साहब हम मतलब बीपी चेक करने के लिए आते हैं आपके चैम्बर में, तब मेरा बीपी बढ़ जाता है, मेरा बीपी 120 घर पे रहता है, डॉक्टर साहब यहाँ पे आते हैं 180 हो जाता है, आपको देखते हैं, बोला हम भी इंसान है, क्यों डरते हो आप? दिन जैसे नहीं डॉक्टर साहब यहाँ पे हमारा कॉमन है, मैं घर जाऊंगा तो कम हो जाएगा. Then the thing is, office blood pressure, even it is high, we don't start at one stretch. We again give time. We ask them to check the blood pressure at home. घर पे चेक करने के लिए बोलते हैं, घर पे रीडिंग्स करने के लिए देखते हैं. एक हफ्ता 10 दिन देने के बाद again we ask them to get the readings. अगर बीपी तभी भी ज्यादा है, like more than 140/90, then we start the medications. Why is it important is, अगर आपका बीपी कंट्रोल नहीं रहेगा, so generally you will end up in complications suddenly. Like recently, I think last 10 days back, मेरे घर में मेरे cousin brother था, he was around 40 years, very active person, very active into business. He was diagnosed to have hypertension since 5 साल पहले कुछ बीपी बताए, वहां पे लोकल डॉक्टर ने बताया, it was 150, 160, was not taking medicines. Suddenly night I got a call that he got up from the bed, washroom को जा रहा था, suddenly he collapsed. मतलब उनका हाथ पैर नहीं उठ रहा था, suddenly मेरा बात डिफरेंस हो रहा है, he called the wife भाग के आई, तब उसको vomiting कुछ हुआ. Then he called me up. At that time I think my phone was in silent mode, I could not pick up the call. Then they went to the local hospital there. By the time they went, he had a brain hemorrhage and he was kept on ventilator and he died. So why I'm saying this incident is, there was an opportunity for him 3-4 years back where he was diagnosed to have blood pressure, but he didn't take the medications. उन्हें medicine लिया नहीं उसे, which was a preventable cause of death. अगर वो लेता था, तो definitely he would not have come to this point. And the problem is, even being doctors, I being a cardiologist, I cannot save him. Because once the brain bleed is there, I shifted him from my place to Hyderabad. He was on ventilator for 5 to 7 days, but I could not save him. Because the bleed was in the main center of the brain. You understand, like you said, the retina, whatever the main path is there, he had a big bleed. So no surgical intervention was there. तो ये सब मैं आपको डराने के लिए नहीं बता रहा हूँ. What I'm saying is, whenever you have an opportunity for yourself or your family members, when you are diagnosed with hypertension or sugar, don't neglect yourself. Try to be aggressive, getting the lifestyle changes done, getting the medications done. मतलब जो भी मेडिसिन है आप बराबर लेंगे तो आपका बीपी कंट्रोल रहेगा, शुगर कंट्रोल रहेगा, तो ये सारे प्रॉब्लम्स नहीं आएंगे, हार्ट अटैक्स के जाने के चांसेस नहीं रहते. सो ऑलमोस्ट 90% ऑफ द डिसीजेस, जो भी रहो, हार्ट रहो, स्ट्रोक रहो, जो भी रहो, अगर आपका शुगर और बीपी दोनों कंट्रोल है, सो 90 to 95% आपका हार्ट के प्रॉब्लम्स नहीं आएंगे. दिस इज गारंटीड. बाकी के 10% why I am saying it's not, it is because of the family history. Family history genetic को कोई change नहीं कर सकता. That is where the concept of screening comes into picture. And of course lifestyle, जैसे बताया, smoking and alcohol, dietary changes. So diet भी एक most important होता है. So diet में बहुत से लोग अपन pizzas, burgers सब खाते हैं. So the question is, we don't take in healthy diet. Healthy diet has a very enormous impact on the heart health. So जो भी refined foods होते हैं, जो भी processed food रहते हैं, better to avoid as much as possible. That is also one of the common cause for blockages, which I showed the cholesterol blockages which is there. And the important thing is hyperlipidemia. Just 2 points about hyperlipidemia, that is cholesterol. So यहाँ पे किसको cholesterol का check किया है यहाँ पे? Anyone has got your cholesterol checked? Okay. So what did the doctor say, sir? LDL is high. How much was your LDL? So it was high. So what did they recommend? Lifestyle. So आपने change किया? Not much. So मतलब, see, the question is, you have screened yourself. आपको cholesterol ज़्यादा है, आपका LDL भी it's like more than 150. So normal will be less than 100. That should be the normal LDL cholesterol. So जो भी bad cholesterol बताते हैं, LDL and triglycerides, ये दोनों bad cholesterol रहते हैं. जब भी आपके blood में ये bad cholesterol ज़्यादा रहता है, तो आपको ये ब्लॉकेजेस के चांसेस ज्यादा रहते हैं, जैसे which I showed. So ये whatever the yellow part you are seeing, it is nothing but your bad cholesterol, the LDL as well as the triglycerides. So जो भी है ये सब धीरे धीरे accumulate होता है. सबको लगता है डॉक्टर साहब हार्ट अटैक सडनली आया है, क्यों आया है? कभी हार्ट अटैक सडनली नहीं आता है, इट टेक्स टाइम. सो जो भी बैड कोलेस्ट्रॉल रहता है ब्लड में, इट स्लोली गोस एंड डिपॉजिट्स इन द वॉल्स ऑफ द आर्टरीज ओवर ए पीरियड ऑफ ईयर्स, मतलब सालों लग जाते. और सडनली कभी स्मोकिंग वगैरह कभी कुछ है, तब ये क्लॉट वगैरह फॉर्म होके, ये क्लॉट जो है ये फॉर्म होके तब हार्ट अटैक आता है. सो दैट इज व्हाई या dairy products. Okay, so like you are saying about milk and milk products. So milk, if you take anyway, it has fat. A lot of fat is there. So toned milk milta hai. So like you say, many people they advertise the concept of double toned milk. Toned milk. Why? Because जो भी milk में रहता है, जो भी निकलता है कोलेस्ट्रॉल, उसमें definitely रहता है. So हम heart patients को milk मना नहीं करते. We ask them to go for toned milk and double toned milk. Why? Because there will be less amount of cholesterol. So ज्यादा रहेगा आपको आपके डाइट में कैलोरी में, तो ऑब्वियसली ये सब एक्स्ट्रा होके यहाँ पे डिपॉजिट होगा, तब अटैक के चांसेस है. बट वी डोंट आस्क देम टू अवॉइड फैट रिलेटेड डाइट, ट्राई टू कीप इट एज लेस एज पॉसिबल. सो मिल्क हो, मिल्क के प्रोडक्ट्स हो, बटर वी नीड टू अवॉइड, घी वी नीड टू अवॉइड, दैट्स इंपॉर्टेंट. सो कोलेस्ट्रॉल के लिए लाइक व्हाट सर वाज सेइंग, लाइफस्टाइल इज द मोस्ट इंपॉर्टेंट. अगर आपका लाइफस्टाइल सबसे इंपॉर्टेंट, वेट रहता है, आपके हाइट के हिसाब से आपके वेट should be very good, मतलब should be appropriate, like the BMI should be 30. So anything the BMI is more than 30, whatever the excess weight is there, the excess cholesterol is there, it will go and deposit there. So that is why you have to keep the body mass index according to height less than 30. तो उसके लिए आपको exercise daily 30 minutes of exercise is the norm. So हफ्ते में आपको जितना भी बिजी रहो, हफ्ते में 5 दिन आपको एक्सरसाइज करना ही है. Doesn't mean कि आपको एक्सरसाइज जॉगिंग जाना है, पार्क जाना है, ऐसा कुछ नहीं है. Even in the office quarters also you need to walk. I think smart apps आजकल आ गए हैं, so everyone keeps a track of the footsteps. So at least 10,000 steps daily चलना ही है. So आजकल तो सबको सोशल मीडिया में मालूम है 10,000 लेना है, तो everyone sees, everyone has a track. So that is important. So the more you walk, the more you avoid the sedentary lifestyle, the less the chances of having all these issues. So ये भी आपको daily में करना ही है. And the another important thing what I wanted to emphasize is regarding the lifestyle. Yeah. So these are some of the things which I told you, all these are contributing to your heart related issues. So one more thing is, हर आदमी को हार्ट अटैक्स मतलब दर्द आता नहीं. 25% of the attacks are silent without any chest pain. किसको आता है? जिसको डायबिटिक है, जिसको शुगर है, उनको दर्द आने का जरूरत नहीं है. They may not have any silence. Suddenly they may seem to breathlessness. कोई दम आता है suddenly, दम आके suddenly collapse हो जाते हैं. So diabetics are more prone, they are at a greater risk for silent heart attacks. And सुबह सुबह सबसे ज्यादा आता है. So heart attacks कभी भी सुनते हैं आप, किसका भी story सुनते हैं, generally they get early in the morning. Why heart attacks are more in the morning? Hormonal. One is hormonal because the sympathetic drive हमारे मतलब in scientific base more amount of sympathetic drive रहता है, तो हार्ट पे लोड गिरता है. Second, विंटर में ज्यादा आता है. विंटर में why? Because winter is more, at that time the drives of all the sympathetic drive will be more, the hormonal changes will be more, cortisol levels will be more, तो उस टाइम पे ज्यादा आता है. So these are some of the things regarding symptom signs मैंने आपको बता दिया है, and these are some of the the things about this thing. These are the common questions with that. So last interesting thing I think I just wanted to emphasize, if you look at the last line, डॉक्टर साहब मैं स्मोक नहीं करता हूँ, मैं ड्रिंक नहीं करता हूँ, like many people may not. So how many of you here smoke? Genuinely? Ungenuinely? No one smokes. Excellent. मतलब smoking के बिना तो मतलब I have never seen a auditorium or people who doesn't smoke and were sitting and saying कि नहीं. How do I drink alcohol? Socially? No one. Yeah. Then I think, sir, you can give some award, for all your employees there. Don't drink, don't smoke. Then I think my role of having a talk with you is unjustified. Smoke नहीं करते, alcohol नहीं करते तो बहुत बढ़िया है. So that is good. So if you take alcohol socially, like there's one slide which I wanted to show. Very interesting one. Yeah. So alcohol in moderation. What does it mean? Wine रहने दो, दारू रहने दो, जो भी रहने दो. So if you take in limits, if you look at most of the studies have shown that it may not harm heart. That's what science says normally. तो उसके लिए बहुत से लोग अपने दादाजी रहने दो, जो भी रहो, अपने परिवार जो 80 साल के रहे, वो बोलते हैं डॉक्टर साहब मैं ज्यादा खाना पीना नहीं करता हूँ, बस मैं रात में थोड़ा लेता हूँ. I take 50-60 ml, have socially with my friends, enjoy myself time, and then I'm happy. You will see his lifestyle, he will be very good. He doesn't have any sugar, any BP, he is active, he goes into the, in the agriculture fields, he has this thing. At those days, people were strong enough. So they used to have alcohol in moderation. And if you do studies, some studies have shown that it has a good impact. It is good for the heart. But the problem is, many people does not stop in limitation. They forget the limitation and they'll end up, having cirrhosis of liver, brain damage or whatever you say, and they'll end up in transplants. So there is a French paradox will say a red wine is always better where, there is a substance which has antioxidant properties which makes the blood less sticky. So it makes it more thinner. Basically, red wine is better. That's what the French people, they have at least daily. You see, have you ever been to Paris? Anyone here? So if you see the French people there, every day evening, they have the tables out there and, outside they have a social life and every evening they have some red wine there. So the advantage what they have seen is it makes the blood less sticky and the chance of having a heart attack is less. So I'm not encouraging. ये नहीं बता रहा हूँ तब सब पियो. The question is moderation. Like in social gatherings, wherever you go, if you take it limit, it has got a positive impact. But still, being a cardiologist, I don't recommend to go for alcohol. I don't drink. Basically, I don't take red wine. I have been to Paris for conferences, presentations, but I never go for drinking and those things. So that is one thing. And other thing is what I wanted to speak about is exercise, which I've told you. This is one thing. And so how we are going to diagnose heart problems? So what are the tests basic to understand? क्या-क्या टेस्ट होते हैं हार्ट प्रॉब्लम्स मालूम करने के लिए? तो एक तो ECG सबको मालूम है, एक तो 2D echo मालूम है. 2D echo is nothing but to scan and know the pumping of the heart. लेकिन बहुत से लोगों को हार्ट चेकअप्स में यही मिलता है, ECG और 2D echo ही रहता है, बाकी टेस्ट कुछ नहीं करते. और बहुत से लोगों को ये नॉर्मल ही रहता है. So you don't need to get diagnosed with heart problems if you have a family history of heart disease. So you have to go for advanced test. तब हम treadmill test करते हैं, stress echo करते हैं, we go for angiogram. Angiogram हर पेशेंट को नहीं करते, जिसको प्रॉब्लम लगता है उसको angiogram करते हैं. वहां पे blockages है तो we do an angioplasty accordingly or a bypass depending upon the number of blockages. So these are the some of the tests which we have to diagnose. But the most important is not getting an ECG echo done, getting your BP checked, which is most important. Getting your sugars checked is most important. Getting your cholesterol checked is most important. So ये तीन चीजें सबसे इंपॉर्टेंट होती है. ये आपको हर साल या 2 साल में एक बार, अगर आपको प्रॉब्लम है तो कंपल्सरी उसको हर फ्रीक्वेंटली 6 महीने में एक बार करना है, या तो साल में 2 साल में एक बार आपको ये टेस्ट करना है. So I think these are some of the things which I wanted to show. Rest are all the basic things. So I think we'll take some questions rather than discussing on a one way. So anyone from the audience who can ask me questions? Yeah.
They advise for somebody with a family history.
Not all. No. पहले मतलब they were previously like 10 years back we used to treat like जिसको family history strong है 50 years है, we used to give aspirin. But आजकल until unless they have some other risk factors like I showed you, cholesterol hai, ya already had some issues like smoking hai, aisa issues to dete. So we calculate the risk calculator. So risk hisab se there is one risk calculator which we have, which we calculate and give it basically. So there is one risk calculator, like you asked me the question. So we calculate, every patient will have a risk calculation. So this is the risk calculator. So this is the hard score risk calculator. We calculate all the parameters we enter. We enter the BP, we enter the cholesterol, we enter whether it's smoking or not, and depending on the risk, we add it up. So these are risk calculators which we take every patient separately and do it. Yes, CT angio is one thing जिसको मतलब angio से डर लगता है, डॉक्टर साहब के पास कार्डियोलॉजिस्ट के पास आएंगे तो फिर चुबाएंगे, वायर डालेंगे, तो all those are notions are there. So they in those patients we advise for CT coronary angiogram, so which gives a rough estimate of the blockages. It is economical. So for normal people, CT coronary angiogram is 8,000. So 8,000 में आपको you can get your test. Suppose you have a family, so you can get a CT angiogram, provided your creatinine is normal. आपका किडनी फंक्शन नॉर्मल होना चाहिए और हम कॉन्ट्रास्ट देके डाई देके चेक करते हैं, तो डिपेंडिंग ऑन दैट यू कैन अंडरस्टैंड वेदर यू हैव ब्लॉकेजेस और नॉट. तो वैसे बहुत से लोग दे गेट इट डन.
So they couldn't believe it. So they went to another doctor and they didn't believe that they had taken angio. They did an angio again. And 2 days later, again went to another doctor and did an angio again, and the patient collapsed.
So that is what the problem क्या होता है, you don't trust the doctor. The problem is trusting. अरे डॉक्टर साहब एंजियो की है, blockages बता रहे हैं, angioplasty. So the problem is always, you should have a trust with the doctor. You should understand why they are doing it. And there may be some doctors who may be commercial, who may be, maybe give an unethical thing, but generally it's less. Most of the doctors, depending on the patient profile, they do an angiogram. They tell you exactly what you want. You take another opinion from your family members if you want, but don't get, like you said, getting an angiogram done at different centers and try to prove that it is wrong. You're wasting your time. Obviously, it's toxic because you're giving low much of contrast. If contrast ज़्यादा दे रहे हैं, तो आपको kidney पे effect आएगा ही. So that will be a big issue for you. And end up he collapsed. He wasted so much of time. Now it is more friendly. So kidney friendly contrasts are there, which are more safer. So it doesn't land up in kidney related issues. Less painful also. The reactions also are less. Basically. Yes, please. Ma'am. You can give the mic. I think someone can volunteer to give the mic there. Low BP, whether it is problematic or not.
Yeah, in my family, for instance, we have low BP, like 110/70 or 110/60, 160 also. What happens is whenever some illness or sickness or some simple fever also makes this go even more worse. Like 90/50, I've faced till 80/50, and they just give some electrolytes and there's no way of, I don't know, like high BP they treat.
Low BP, how to get away?
We don't get it treated. We don't have as such predispositions so far. So, but then the low BP is there for everybody.
Yeah. So good question. So the thing is, for all hypertensives, for high blood pressure, we give the treatment. But for low blood pressure, depending upon the age, we treat it. Like for all young females, if you ask, most of the young females, you don't have a blood pressure more than 100. Most of them, you will have 90, 100, 110 only. It is not a worrisome thing. So the most important thing is hydration. So you should hydrate yourself. Like you said, electrolytes will be given most of the times. So electrolyte disturbance and all those things make your blood pressure low. So until unless you are symptomatic, like you have some giddiness, अगर आपको चक्कर आ रहा है, अगर आपको weakness लग रहा है, आपका BP बहुत down हो रहा है, then we give some injections and try to improve it. Otherwise, routine water, electrolyte correction, hydration proper is sufficient.
So in this case, a lot of times when the normal BP itself is 160 or something like that, when we have this tiredness and we check the BP, and if this is now 110, 120 and 80, does it mean that, my BP or so is a little elevated?
No.
Normal range.
So normal blood pressure is up to 130/80. 130/80 होता है, that is normal. Anything more than 130 and 140 only we treat it. So we don't treat, like I said, एक ही बार में BP 140 हो गए तो हम उनको BP बोल के नहीं बताते. We ask them to control the lifestyle, ask them to change their bad habits, to get their other biochemical parameters like sugar, BP, water, get it controlled, and then only we treat it. तो एक sitting में हम कभी treat नहीं करते. So 130 is acceptable. There is nothing like that. So more than 140 only you have to treat it. Suppose उनको headache है या giddiness है, 150, 160 आ रहा है, then we treat them.
Thank you.
Sir, it's regarding tachycardia. Like in my family history from my mother's side, most of them have the resting even heartbeat around 105 to 110. And from last almost 10 years, they're doing every year checkup. It remains the same,
110.
110, 105. So is it something that is normal in the family or it is related to some sort of maybe
Age of-
offshoot of any
Understood.
sort of-
Age कितना है?
Sir, it is 45 to 55, all the
Okay.
people around.
So आप पूछिए जैसा if you look at the Indian patients, Indians में क्या होता है? We have more of sympathetic drive ज्यादा होता है. Body में जो sympathetic drive जो मैं बात कर रहा था, the heart rates always will be more than 90 and 100 for all the young patients. It is with exact reason like I said, sympathetic mechanism is more. तो it's not a worrisome thing. अगर आपको 100 के ऊपर होने के बाद आपको discomfort लगता है, like हार्ट बीट ज्यादा है, चले तो धड़कन तेज होता है, then we need to give medications. So we have a lot of drugs like beta blockers, like we give beta blockers and try to control the heart rate. So ideally it should be 80, 70 to 80, which is okay. So anything more than 100 which will make you aware of your own heartbeat, then you will feel panic, you will feel some palpitations, you will feel some discomfort in the chest, some fatigability, तब हम उसको treat करते हैं. Otherwise we don't treat it. Yes, correct.
Thank you.
Yeah, that.
Yeah, I wanted to ask if there is any time-related pattern in BP measurements. Like if we measure in the morning, sometimes, like mostly it's higher when it's as compared to when you measure at the night or something. So is that a matter of concern or something?
Yes. Yes, if you look at the blood pressure morning से evening, मतलब night time में BP कम होता है. So after 10 o'clock, if we check, there will be a dip in the normal pattern of blood pressure by 10 millimeters. Early morning, when you wake up, the BP will be more. Like I said, the sympathetic drive will be more. Catecholamine secretion ज़्यादा रहता है blood में. तब heartbeat and blood pressure ज़्यादा रहता है, which is a normal thing. So anything above the readings, like I said, 135, 140 के ऊपर होता है, then we need to recheck yourself.
Like if it's consistently high in the morning for like 7 days and normal at the evening, any matter of concern? Or
Yeah. अगर ज़्यादा है morning hours में more than 140, we need to treat.
Okay.
More than 140. Otherwise, no.
Thank you.
So not only we treat only the BP, बाकी के factors भी देखते हैं. अगर उनका weight ज़्यादा है, अगर उनको cholesterol है, then we treat it. Then we treat the 130 and 140 hours blood pressure. So comorbidities बोलते हैं, जैसे other risk factors है, so that we all the factors into consideration and treat. एक factor को लेके हम treat नहीं करते.
Thank you.
So any questions from the smoking side? Alcohol कोई पीता नहीं है तो करते तो कोई no one wants the question from the smoking. Yeah.
Yeah, very informative talk, Doctor sir. Thank you so much for here. Actually, if we wish to summarize this talk, the overall health, body health, the good health, I would say, it is all about the vasodilation. The more relax our vessels, the more relaxed is our body.
True.
So to practice that means how the meditation, relaxing exercise, breathing exercise will help. Will that be, the first choice to replace the medicine?
Obviously. So the whole goal is not medicines. Medicine always comes lower down. वही मैं बता रहा हूँ. Our concept of health, heart health is preventive health. आपने को medicine लेके treat नहीं करना है. Your concept is like what you said, always exercise always holds at the top. तो कोई भी patient, heart का patient आता है, medicines only are there to buy you time to make the risk factors corrected, but it will not help you in the long run. The long run is always the exercise, like emphasized, the aerobic exercises. If you have time, youngsters, daily walking, aerobic activity, you have to do it. अगर नहीं हो रहा है time, like you said, meditation, pranayam. So our Indian tradition is so extraordinary, like Modi ji and all, they all emphasize the importance of mental health. So mental health, which I was talking, what you are exactly describing, I think that's the question which you have. Mental health is one thing. If you have a good mental health, all the problems of your body will come down. So by having a good mental health means using meditation, your yoga, your pranayam, you should practice. Anyone is okay. So whatever the tradition you're good at, try to practice it in your daily lifestyle. So at least 30 to 40 minutes you should take time. हर रोज लेना ही चाहिए, सुबह रो या शाम में रो. डॉक्टर साहब मेरे को सवेरे टाइम नहीं है, मेरे को सिंह साहब सवेरे 8 बजे बुला लेते हैं, 9 बजे बुला लेते हैं, तो चांस नहीं है, तो शाम में करो. Like me to say. So it doesn't mean that you need to blame anyone, you need to take excuses. So take time for yourself. खुद के लिए टाइम लेना है. So end of the day अगर आपका mental health, आपका physical health रहेगा, तो आपका खर्चा भी बच जाएगा. कल फ्यूचर में आधा तो पैसे आपको हेल्थ में जाएंगे. So after certain time, most of your expenditure, most of your savings, all will be lost in medicine already. So that is what we see nowadays in our practice. Yeah.
Any specific exercises, sir? Or just
Any type of exercise you are good at. So aerobic में जैसा बोले swimming करो, that's the best exercise if you have that. तो सबको swimming pools तो होता नहीं है, तो swimming pool के सिवा कुछ भी कर सकते हैं आप. Like by cycling is one of the good exercise. Then you can go for cricket, any sports activity, shuttle, कुछ भी करो. So any aerobic activity is good. And of course gym, like isometric exercise, gym also is good. So अगर आपका अच्छा trainer है कोई है, so they will help you both the cardio exercises as well as muscle exercises.
So happening at the gym.
That's why I said trained. So you should have a good trainer. ऐसा नहीं कि जाके आप 50 किलो उठ जाओ, एक उठा लो, एक या 2 दिन में मेरा मसल बढ़ जाएगा, तो तीसरे दिन कोलैप्स हो गया. So don't get yourself going to the gym and try to do experiments. So you go in a graded exercise fashion. That's what the thing is. Most of the problem is you don't screen your heart. What is happening in nowadays gym is बहुत से लोग जाके they don't know what they have a heart problem. They don't know they have some cardiomyopathy or something like problem. They go to the exercise, they take 50 kgs and suddenly it got an exertion of the heart and they collapse. तो ऐसे 2-3 instances अपने YouTube में देखे हैं, social media में देखे हैं. ये क्यों होता है? Because they don't know they have their heart problem. They are fit and suddenly they collapse. So that is why screening yourself before you go for strenuous exercise is important. So जो भी मैराथन जाता है, जो भी 10 किलोमीटर भागना है या 21 किलोमीटर भागना है, always they should get your basic things like ECG and echo and TMT done. Make it confirm that they don't have any major heart related issues and then they can exert. तो आप trekking जाओ, आप कहीं भी जाओ, mountain climb करो, trekking जाओ, कहीं भी जाओ, it will not be a major issue. Otherwise you will land up in problems. You understood? Because you don't screen. आपको मालूम नहीं है genetic problem है, तो आपका heart का issue जब तक आप text नहीं करेंगे तो मालूम नहीं पड़ेगा. And that's how people collapse, especially youngsters.
one thing in my family, sir, last November 2nd, my mother had some left hand pain, sir. Then we had taken her to hospital. My siblings are there. Then they diagnosed with ECG, subabdominal ECG. So just started immediate treatment. Unfortunately, I lost her, sir. Within 2 hours, she passed away.
Oh, so what was her complaint?
Actually, she's having some pain in the left hand, sir. So I brought that this one also, sir. What they had diagnosed is due to cardiogenic shock, ASSTWMI, severe.
STEMI. So like I said, it's a major, it's
What
major.
exactly it is, sir? We don't
So,
know what, sir, that she's having.
STEMI is nothing but ST elevation MI. It is a major heart attack.
She's
Like I
suffering
said,
cold, sir.
yeah. So you patients will not give time if you have a major heart attack. Like I said, when it is 100% occluded, you call it as a STEMI, ST elevation MI. तब आपको बेचैनी होना, ये सब कब होता है? Like your mother was a diabetic.
Yes.
Have you get your heart checked before?
No, sir. Actually, she used to have some neuro issues, sir. We used to give that medicine to her. We never know that she's having.
Many sugar patients, BP patients, they'll end up in silent heart attacks. So by the time they come to the hospital, ECG will be there. You don't have time. Your BP will be down, like I said.
BP.
So it is a cardiogenic shock, and you don't have time to do an angioplasty also for that patient. So many times we lose patients.
Thanks.
So that is where I am saying you need to, if you have a diabetic in your family, if you have a hypertension in your family, get yourself checked. Matlab your family members checked. There are many tests, like Madam was telling about CT coronary angio is there, CT calcium score is there. You don't need to do angio for every patient. There are some cases we do a calcium score and screen whether the calcium score is 0 or more than 100. If it is 0, you don't have a blockage. If it is more than 100, we treat them. That's how we differentiate.
One thing, probably haven't spoken here.
Around 2 weeks back, one of my own schoolmate, he passed away, and he was into the computer and all those things. What people were saying is his habits were very clean, vegetarian by nature, but only thing is he was not sleeping enough. So people were talking that sleep.
So that's why mental health means sleep also comes into picture. So everyone should have at least 6 to 7 hours of sleep. mandatory, which is very good. So if you don't have a proper sleep, irrespective of whatever might be the cause, that is one of the serious concern. So it will have indirectly an undue stress on your cardiovascular system. So it will have an effect on the stress. Definitely the patients land up in problems. So having a sleep, health also is equally important. What I mean to say is, so बहुत से लोग को age के हिसाब से 70 के ऊपर, that is a different thing. नींद नहीं आती है डॉक्टर साहब वो 70 के, but for the youngsters to don't have a sleep is a major concern. So that's why if you don't exercise yourself, अगर आपको body को थकाओगे नहीं तो आपको नींद कैसे आएगी? So that is why exertion, physical activity, exercise all comes into picture. So I'm expecting some smoking questions. So no one is asking from their side, last side. Anyone want to ask that? No. Pardon?
Publicly it will not come. If smoking question answers, publicly it won't come.
Don't come.
If you ask them in your chamber, probably they will tell.
Yeah. Okay, Raj, you don't. I am smoking. I'm not asking. Just can ask something about smoking. Anything is there or anything. So for smoking, if you ask me, some persons who smoke, they cannot come out of smoking. So why I emphasize smoking? Because last week, I think last 10 days back, I have done 10 angioplasty cases, all with 30s and 40s. So if you see the risk factors, 80 to 90% were smokers. So they didn't have any other risk factors. The only concept was smoking. They used to take almost 1 to 2 packs per day. Now all have quit smoking after doing an angioplasty, after putting a stent. Now they're very conscious. But the problem is already their heart is damaged. We have already done an angioplasty, whatever the basic treatment, I have done it. But the quality of life which we'll have, which he had before, now he will not have. He has to quit smoking. He has to take medicines. His lifestyle is changed. He cannot run. So there are many other things which comes into picture. Once you get a attack like thing, I mean to say. So that is why if you cannot quit smoking, if you are unable because of the cravings, there are many helping aids like nicotine replacement therapies are there. We have nicotine patches. The psychiatrist helps you out, in counseling. So a lot of different things are there. So agar nahi ho raha hai, you can take helps and you can sort it out also. So that is one of the strongest risk factor for heart attacks, I mean to say.
Synthesized protein consumption is also trying. So that is also the risk factor adding in.
Obviously. So anything unnatural foods, anything always are a risk factor. So refined foods. I think I didn't show you one slide where one slide was about the food. So important thing about the food is, so always this should be your healthy eating plate. So कभी भी एक अपन भोजन लेते हैं प्लेट में, तो 1/4 should be vegetables. पूरे vegetables रहना चाहिए. 1/4 should be fruits of all colors, whatever might be the colors. 1/4 should be whole grains, not refined grains. Whole grains है, जो भी खाना है refined के बिना, all type of grains are acceptable. 1/4, like you said, healthy protein. Protein means non-vegetarian, which is also good, like chicken, like mutton, except red meat. सारे अच्छे. So you need to take less oil, more amount of chicken diet or something like that, which adds 25% of your component. ये चारे चीज आपको रहेंगे, तो it's called as a healthy diet. So refined foods like sugar, so whatever the white particles like salt and sugar, all we need to avoid. Carbohydrates, rice also we need to curtail as much as possible. So rice also is one of the, apna culture hai, Telangana ka culture hai ki we take a lot of rice. Of course, rice is good, but you have to take it in limit. So less than, like I said, 25% of your diet. That should be there. Remaining 75, all these things you need to cover it up. So regarding one more thing, I think oils. So oil ke bare mein kisko kuch puchna hai? Which is one of the major concerns of oils.
That starchy food cause lipid generation as compared to lipid diet. So
Starchy food.
starchy.
When
So
compared to
it is main cause of
yes,
blood
because most of the calories they come from carbohydrates. So whatever the excess carbohydrate you take rice, it will be converted into cholesterol, into starch only, and nothing but the cholesterol which I showed you. So all the excess
some social media influencer also are suggesting ghee. So
see, ghee is good. No one says the ghee. अगर आप पुराने ज़माने में लोग देखेंगे तो सब लोग घी खाते थे. All the 70s and 80s people who are still living, they have all their pulkas or chapatis. They'll take a ghee, good amount of ghee, and they have their food. they are healthy. Doesn't mean that ghee is bad. But the question is, there is a lot of adulteration. Lot of adulteration in ghee. You don't get a good ghee like you get in the rural areas. जो देसी घी मिलता है वो आपको cities में कहाँ मिलेगा? So you don't know whether the ghee is of good quality or not. So that's why we try to avoid as much as this kind of foods as much as possible.
One more thing, what is the next step after getting diagnosed for risk that suppose I am risk for heart attack? So what is next step? What is diagnostic?
Once the
Sorry, what is treatment option that are available?
So treatment option after heart attack, you mean to say? After heart risk for the heart. You need to change those risk factors. जैसे मैंने बताया, शुगर है, शुगर कंट्रोल में रखना है, मेडिसिन लो या इंसुलिन लो, जो भी लो, आपका HbA1c less than 7 रहना चाहिए. Sugar should be as much as control because excess sugar will be converted to cholesterol. तो वो blockages को ये होता है. BP कंट्रोल में रखना है. So all the risk factors you should avoid as much as possible. So 90% ये दोनों से आता है, शुगर और BP से आता है. Family history is only screening. We don't have treatment for right now. We don't have genetic test to diagnose. अभी genetic test इतना costly है कि no one can afford. लाखों में रहता है. And we don't have proper commercially available kits also for that. तो वो तो बहुत ही मुश्किल है Indian scenario में. So आपको genetic background है तो आपको screen करना ही. हर 2 साल में एक बार, like I said, getting the test done, getting a TMT done, getting a CT angio done, if required, depending upon the expertise of a cardiologist or something like that.
So it's just to know that you begin your talk with health checkup like once or twice. This was a question. So one thing I want to clarify. So what, like if you go to multiple hospitals, each hospital its policies of health checkup. We see multiple premium, standard. So people has a lot. So as a doctor, what do you recommend? Because you said post-COVID, now we are seeing a lot of even in engages. So what kind of test should be tested as a basics, as a yearly or twice? And second question, which I want to ask is like, so testing is the prevention is a better. So now after the diabetic rise and nowadays people start to buy like EcoCheck or anything. And now I see some people even buy instruments for pressure check also. What you say in this era or future that what should be some instrument, basic instrument that every home should start to have so that they can check periodically, like no need to like every place we won't get a hospitals of proper, like I don't mean big instrument, like what do you think the future we should have in our home, at least to make sure we are fine?
Excellent question. So I think if you look at the first question you asked me, health checkups, there are a lot of hospitals, a lot of corporates, they give different packages. But the concept is you don't need to go for premium checkups and all those things. So the basic checkup is required. Like you should cover all the basic blood tests, which will be there in most of the hospitals. Heart point of view, you can get an ECG and echo. Treadmill, if you are able to run, that is most important. Cancer screening is important. So after the age of 35 and 40, every person should get at least twice yearly checked. For females, you have to get your mammography, you have to get your pap smear checked every 2 to 3 years. For males, of course, cancer screening basic will be there like prostate, which comes after 45, 50. Whereas for females, it's more important, cancer screening. And at the same time, like you asked, the devices, sugars, you don't need to keep in your house unless your family is, anyone is a diabetic. Like you have glucometers, you have a lot of continuous glucose monitoring called as CGM, continuous glucose monitoring, where many diabetic patients will be using here. And whenever you have, they will just check it there and take your insulin shots or tablets, something. So that is not required for everything, but blood pressure monitoring should be there in every house. हर घर में BP monitor रहना ही चाहिए. So whatever might be the instrument, you have a lot of automated machines are there. So you can get your chips checked regularly, like once in a, twice in a month or something like that. आप आपका रेगुलर चेक कर सकते हो, घर पे रीडिंग ले लो. अगर ज्यादा आ रहा है, don't get panic, take multiple readings and go to consult a physician. A lot of physicians who will help you out in understanding your BP readings and so on. Yeah, these two are basic things, what I will say. Remaining all will be done in lab based. तो ये दोनों चीजें ही सबसे important. Basic health checkups.
Blood check. One is blood check, and another one was this cancer one and heart one. So this three are saying it's meaning.
Yeah, blood check में, I mean to say there are kidney like checks also. Creatine होता है. So all the body का जो भी है hormonal changes, सब कुछ उसमें cover होता है. So I don't mean to say only heart and kidney and so on. All will be covered. Lung issues like PFT will be there. Lung का भी cover होता है. सो स्मोकर्स को जो भी है लंग का भी कवर होता है, लंग कैंसर से भी समझ में आएगा, एक्सरे में समझ में
Because
आएगा.
why? Because if we know what should be a basics, we don't need to take unnecessarily all the pain. Because as a human, we think we need to know the best. Are we really best in every part? This is a
So other thing is बहुत से लोग चेकअप्स कराते हैं, घर पे 2000 का पैकेज आया, 2500 का पैकेज आया, वो सबसे कम हो रहा है, घर पे बुला लेते कर लेते. क्वेश्चन इज वो कराएंगे, वो तो सब नॉर्मल ही रहेगा, बट द क्वेश्चन इज यू नीड टू कंसल्ट ए फिजिशियन. You take the advice of a physician or nearby practitioner, take their advice and then only go for test. Don't get test yourself unnecessary because बहुत से टेस्ट आपको कवर नहीं होंगे, आपको मालूम नहीं है कौन सा बराबर है कौन सा नहीं है. So take the expertise and then only you get your test done. So always you get experts. इंडिया में तो ये बहुत बड़ा लग्जरी है. यूएस में तो you need to take appointment. एक कार्डियोलॉजिस्ट से मिलना है तो आपको 6 महीने का अपॉइंटमेंट चाहिए. तो which is tough for you in the US problem. इंडिया में तो it's a luxury. आपको एक कंसल्टेशन लेंगे तो आपको डॉक्टर साहब मिल जाएंगे. आप very easy है. So that luxury, I think everyone should utilize the opportunity. What I mean to say is. Singh साहब आप पूछना चाह रहे हैं, आप any question you want?
Side symptoms are quite similar to heart attack symptoms. So how we can differentiate between the two? Is it anxiety issue or a cortisol issue, like higher cortisol levels?
So depending upon the other symptoms, anxiety may you have heart rate increase, you have sweatings, you have perspiration, palpitations. But the thing is, most of the time your ECG will be normal. You don't have any comorbidities like sugar, BP नहीं होता है, smoking नहीं होता है. So depending on the patient subject, we take the decision. So we don't say every patient has heartbeat ज़्यादा है तो उसको anxiety है नहीं बता सकते. There are some underlying heart issues also. So that's why the concept of health checks comes into picture. तब एको में मालूम पड़ जाता है ये सब valvular problem है, कुछ mitral stenosis है, कुछ और problem है. ये सब हम anxiety सोचते हैं, but he has an underlying heart issue in that. Yeah. So among the oils, if you look at the cooking oil, there are most of the oil should be it should be like routine what we get in your routine market only, like sunflower, rice bran oil, cold pressed oil, koi bhi oil acha hai. But the point is, two oils which we generally, being adults, we don't recommend is, one is the palm oil, which contains a lot of saturated fatty acids. Second one is coconut oil. So these two oils, for all heart patients, we ask them to avoid as much as possible. And the second thing is, try to change your oil. आपको हर 2 महीने में oil change करना चाहिए. For it is useful for, mother cook कर रही है तो it is useful for the whole family also, not only for the heart patients, for all the family members. सबसे thing is, don't buy the concept of 5-5 किलो का जो पैकेज मिलता है, ऑफर में मिल रहा है, एक ही दम 5-10 किलो का पैकेज मत खरीदिए. Try to get less oils, so that every 2 years, 2 months, once you finish, you can change to other oil. Otherwise, you'll be forced to use that oils the same time for a long period of time. Understood? That's why we ask to change every 2 months. So that helps, the heart also. Second is the olive oil also. Olive oil is also good, but the problem with the olive oil is the taste will be little different. So that is why many people don't, take interest in taking the olive oils. Otherwise, all the Mediterranean belt, if you look at the, Mediterranean diet, they contain mainly of olive oil. So that is also very good. So in salads and dressings, they keep the olive oil and they, they have their regular, most of the people, especially the Americans, they have this.
As a cardiologist, how much oil do you take, may I ask, per day?
I don't calculate, but the thing is we keep it as less as possible. So I being a Jain, I'm vegetarian, so I don't take much of oil, much of this thing also. So regarding all the homemade foods, most of the times we go out, we have a food, but less, as much as possible.
Patients recommend only 4 tablespoons, but that's too less.
Yeah, that's
for
too
Indian
less.
food.
Fat, because fat is also equally important. So, जैसे मैं content बताया, not only things, fat is also equally important. So oil content में अपना आता है. So have to have oil, but less quantity wherever it is required. I'm going to say.
Thank you.
Talking about the most common deficiencies, I guess everybody will relate to nowadays, that because of the lifestyle and all, that is vitamin D and B12. Generally, they are found to be the most deficient in youngsters as well as in. Does it have any correlation? Does it have any correlation to the coronary diseases?
No, nothing correlation. But the thing is, like you said, vitamin D तो सबको कम ही रहेगा. सुबह 9 बजे you come to the office, you go at 5, you don't have sun exposure at all. So until unless you have a sun bath, you don't get a vitamin D at all. So the food all will have deprived of vitamin D. So vitamin deficiency से आप यहाँ पे सब कुछ check करेंगे, almost 95% will have vitamin D deficiency. Even vitamin B12 also is the same. अगर आप non-veg भी लेते हैं, almost I think 1 in 4 will have vitamin B12 deficiency. So all these are once you diagnose, once you get the test only, you will have it. So बहुत से बार हमारे patients आते हैं, हमारे पास weakness होता है, generalized weakness होता है. तो one of the reason खून कम होता है, खून कम है, one of the common causes vitamin B12 deficiency. So until unless you don't supplement them, their weakness will not improve. Their appetite will not improve.
कार्डियोलॉजिस्ट, इनका डॉक्टर जो है, सब कुछ है, लिखी हुई है, कैसा लग रहा है आपको?
मतलब
What is your feeling as a cardiologist?
regarding what?
It's overall like your practice and the experience of the cases you see.
See, if there are two ways of looking as being a cardiologist, one is from the professional point of view and a second one from the non-professional point of view. If you ask me from the non-professional point of view, it is, the profession is too stressful, too hectic, family time gets compromised, we don't go to functions, we don't go to meetings, other things, family time will be lost. We go to emergencies in the night. We don't have time for ourselves, if you ask me. The stress, like what one of you was pointing out, definitely for being in a profession, we have a lot of stress also. So managing that stress is really a difficult time for us also. So we take time, understanding how we need to take time for ourselves. So for me, what I do is, I think I did my MBBS 99, I think, where I started. I did from Warangal. So from that day on, I made it a routine that हर सुबह मेरे को ground को जाना ही है. I go to the ground at any cost, whether it's exams, it's raining or something. I jog for 30-40 minutes. I take time for myself. So that is the best way of taking your stress out. So whether it's a profession related or something else. So that's how I manage my health and I manage my time. So abhi bhi 25 saal ke baad bhi I do my exercise. Whatever might be the hectic schedule, I take time for myself. So that is one way of managing my time. Second thing, like you said, professional point of view, of course. Interventions, हमारा जो concept जो profession है, it gives us lot of satisfaction for us. बहुत से youngsters को angioplasty करते हैं, we do complex cases, we present in interventional forums. So हमारा professional satisfaction is definitely good. And I say I'm proud of being a cardiologist because God has given me this opportunity to serve people, to give talks, to make them aware, to make them understand. So we're giving some sort of service back to the society. So that is one way of what we look at. It is one of the best profession which I feel, being a cardiologist. But on the contrary side, our profession you have the plus and minuses. So we need to take the positives, we need to take the negatives out. That's what. I was saying to Singh Sahab when I came, I felt that I was coming for some some entertainment here, away from the crowd. Traffic आने के बाद लग रहा है अच्छा है आज इधर ही रहना है, इधर ही 2 घंटे we'll spend time here. Of course, definitely, getting closer to the nature, getting closer to this thing makes us more, joyful for us. So thank you very much, for your patient hearing. Thank you for your questions, and I hope I didn't bore you much. So if you have any queries, also, I think you are free to, contact me for any queries on this thing. You can mail me down. You can take number. I think Harsha is there. You can take number from me also. So thank you, Singh Sahab. Thank you very much.
And thank you, Mr. Harsha. It's always available at board. ऐसे ही मस्त रहें, स्वस्थ रहें, अपने दिल का ध्यान रखें, अपने इंस्टीट्यूट का ध्यान रखें, वर्क हार्ड वर्क से कोई दिल का कोई रिलेशन नहीं है. And then take very good care of your health. This is utmost important in life. Everything else, I mean, can be some replacement can be there, but there is no replacement of health. So I thank you very much.
Yeah. Once a point, I think what sir was saying is like, I think you were pointing it out. A happy person or a person who is, very happy, definitely, the heart related issues will be less on it. So wherever you be in your profession, whatever might be your work, I think staying yourself, motivated yourself and being happy makes you free from most of the diseases. So that is also one of the mantra of life. Thank you.
Thank you, sir. Thank you very much.
Yes. Yeah. Oh, thank you.
We
Thank you.
believe in
Thank you.
plantation.
Oh, thank you. Green environment and the thing.
As many
Yeah.
as plants we have. planted.
Oh,
This is
thank you,
not-
sir.
oh,
Thank
This
you.
is something more.
Oh, thank
you
you very
for
much.
coming.
Thank you, sir. Thank you. Thank you. Thank you.
Looking at it.
Yeah, no, I will have, sir. I have no issues.
पवन एक बार मैडम से मिला देना.
In 5 minutes, we're going to start the BLS CPR session. Please.
Yes.
So Dr. Jitendra sir has been explained to you regarding the cardiac stroke. So if we follow those instructions well, then we will be safe. If we don't follow them, then we will come into picture. Myself, Dr. Dayakar Reddy from Emergency Department, Yashoda Hospital, ITech City. So today we are going to learn about basic life support. Do you have any idea regarding BLS? What is BLS? Anyone? Yeah, it's basic life support. We have ACLS also, Advanced Cardiac Life Support, but we teach only BLS. Why not ACLS? Because in BLS, you don't need any doctor support, you don't need any medications, you don't need any instrument. In ACLS, this all comes into ACLS, doctor support, medication, instrument. So in BLS, you not need to go you don't have to study up cardiac side. In BLS, you need to know only few basic steps. So we are going to discuss those steps now. So do you know what is our national line emergency number? National emergency number. That is state emergency number. Yeah, 112 is our national emergency number, which we can call to 112 if anything happens. So if not in state, we have 108. So for example, you have come to office, you have seen a person collapsed in front of you. So what the first step you are going to do? The first step is you have to make sure the scene is safe. Because when you are approaching the victim, you should be safer from your side. We don't know what might cause the victim to collapse. So first thing first, spot an emergency, then what to do, what not to do. This is our national emergency number. So first, check the scene safety. When you are approaching to the victim, you have to be careful before you are reaching the victim. We don't know what might cause the victim to collapse, might be electrical shock or any other possible injuries. So make sure there is victim is safe, the surrounding. Then you can approach to the patient. Without proper safety, don't go to the victims. Then if you think the scene is safety, you can call for help, like dialing 112 or 108, ask them to get AED. Then you can check the patient pulse by checking his carotid pulse. Place the two fingers in the mid portion of the neck, which we call trachea, then slightly left or right. If you are in the right side, go towards the right. If you are in the left side, go towards the left. And just 2 centimeters below, you find one groove. There will be carotid pulse. So check for that pulse for 10 seconds. Do not wait for more than 10 seconds. Can you all able to try to do once? Keep your finger in the midline, because you have to know what is the normal thing, then only you can see whether pulse is there or not there. So keep in the midline, everyone. Just slightly left or right, 2 centimeters below, you feel one groove. Check there is a pulse. So you will feel one pulsatile movement, which is touching your fingers. Do you feel, everyone? Okay. If you feel, then wait till the ambulance comes and let them take over. If you don't feel any pulse, or if you are not sure, and you should not wait for more than 10 seconds, then you have to start CPR. Do you know why only we check for central pulse? Why not radial? In movies, when patients goes to the doctor, first they'll try to check radial pulse. But in this picture, we will check only carotid pulse. Do you know why? Because it is close to the heart. Our heart is located here. It is close to the heart. So you will have more nearest the vessel is the carotid one. So you can check the carotid pulse rather than checking radial pulse. If the carotid pulse is there, if the patient is unconscious, wait till the ambulance comes. If there is no pulse, immediately start CPR. So, as I said, first comes safety. Then, when you approach the patient, tap on the shoulders whether the patient is responsive or not responsive. Is not responding, victims need help. Call for backup. Is a 108 dialing or 112. If pulse is there, okay. If pulse is not there, start CPR. As I said, this is the carotid pulse where we check. One is on the right side, one is on the left side. But when you have to make sure you're checking only on the one side. Do not check on both sides because you are making compromise of blood flow to the brain. So check only one side only. Do not check on the both sides. So this is how we will check their pulse. If pulse is there, as I said, wait, let the help come back, let the help come and take over. If there is no pulse, start CPR. Make the patient on a flat surface. Then bend down onto knees, close your fingers together, interlock, and keep in the sternum, midline of the sternum. We call it as a nipple line. Keep in the midline, 1/3 of the sternum. Do not just give 30 compressions and 2 breaths. When you are doing this, you should be perpendicular to the victim's body. You should not lean forward or you should not lean more backward. You should be more perpendicular to the victim's body. So the pressure will be more when you're pressing, when you're giving compressions. So this is the position. Kneel on patient side, make the patient on a flat or front surface. Then bend on knees, interlock as is in a 90 degrees perpendicular to the patient. When you're doing compressions, do not bend your elbows. You have to keep both elbows straight. Then you have to compress. We call it as a high quality CPR. You have to give 100 to 120 per minute, 1/3 depth of the chest diameter or roughly 2 inches. Allow chest to complete recoil, minimize the interruption. Allow complete chest recoil because when you are pumping, you have to make sure to release the muscle. Then the flow comes back to the heart. Again, when you are pressing, the flow goes to the forward. When you're releasing, the blood comes into the heart. So it is a circle. When you, for example, there is a full bottle of water. When you try to squeeze, the pressure will be more. If you relax, we can fill the bottle. Same way, if you're pressing, the blood flow will go to the other parts of the body. If you're relaxing, the blood flow back comes to the heart. When you are doing CPR, try to minimize the interruption. At least 2 minutes you have to do continuous CPR. That is for in adult cases. In children's, you can use either 2 fingers or you can keep either 2 thumbs. In children, in adult, it is a 30:2 compressions. In children, it is 15:2. Because in children, they might be getting cardiac arrest because of hypoxic injury, because of low oxygen level. So we give more oxygen in children when comparatively adults. In adults, we do 30:2. In children, we give 15:2. 15 compressions, 2 breaths. In adults, 30 compressions, 2 breaths. So when you are giving rescue breaths, make sure there is no object in the victim's oral cavity. For example, this is in non-traumatic cases. In traumatic cases, we try to avoid head lift and chin lift. In non-traumatic cases, just lift the chin, pull the head up, then close both mouth, nostrils and you have to give 2 breaths. When you are giving 2 breaths, you have to see the raising movement of the chest. Then you are giving adequate rescue breaths. If not, there is no sufficient rescue breath you are giving. So is it necessary to give in all patients? No, because we don't know the other side person's health. So you are trying to help him, but we don't know his background, health background. So if it is your family members, you can, his background, medical background, then you can give rescue based by keeping mouth to mouth. But if you think he's outsider and you want to be safe from your side, but you want to help, then there is no role of giving rescue based by mouth to mouth. We will have some devices, but we don't get some immediately. At that time, you can do only CPR. Rescue breaths are not necessary for everyone. At that time, you can give continuous CPR, that will be good enough. But if you know the medical background, if it's in your family members, you can give rescue breaths. If not, try to avoid by giving only chest compressions. So as this is the jaw thrust we do in traumatic cases, we keep our mandible below the mandible. We pull up. This is we don't do in traumatic cases because we don't know what is the presentation of spine. So we try to avoid spine injury in traumatic cases. As I said, rescue brace depends upon you. If you want to give, you can give. If not, only compressions will be good enough. So each breath should be around 1 second. For 2 breaths, 2 seconds. After 2 minutes, check the pulse. If the pulse is there, well and good, make him in lateral position. I mean, one side. If there is no pulse, continue CPR till the backup comes. As I said, these are the instruments which we don't available in all scenarios. If you have this kind of devices, you can give you can keep barrier as the mask and you can give breaths. If you don't available, then try to avoid if unknown person. If known person, you can give. This is we use in our hospitals. So it won't come into regular practice. This is we use in, as I said, ACLS. We use this kind of amber bag. So in BLS, we require 2 rescuers. First rescue should start the compression as described before. Second one will stay at the head end and giving breaths. Continuously, we have to give 5 cycles, whereas roughly 2 minutes. So till 2 minutes, you're doing CPR. Try not to interrupt the CPRs. Minimum 2 minutes, you have to give continuous CPR. Unless if you are tired, you can come side. You do not strain much yourself when you are giving CPR. Then after 5 cycles, sir, after 2 minutes, then you have to stop the CPR, check for the pulse. If the pulse is there, make him on lateral side. If pulse is not there, again continue CPR. When when there are 2 rescue or 3 rescue, take their help. This is the time where you can interrupt. You can change the position, not in the mid CPR. If there is no one, then wait till until the backup comes. Till when backups comes, they will get this machine AED, automated external defibrillators. I think nowadays in most of the big bus stops, airports, railway tracks, near software companies, they are using this kind of devices. So till this device comes, we can do CPR. After getting the devices, we have to attach this device to the chest. So for this also, you not need required any knowledge how it works. Everything will be giving instruction by the device itself only. You will see there are two pairs in AED devices. There will be marking one right, one left. Right, even the position they will describe the position of the where you have to place the pads. Then you have to place one on the right below the clavicle, one on the left here. Then attach the pads to the AED machine, plug in the connector, then it will analyze this. If it is a shockable, it will analyze the rhythm. Then if it is a shockable rhythm, it will deliver the shock. If it is a not shockable rhythm, it will not give any instructions for you. In that case, you can start CPR. If it is a shockable rhythm, it will say shockable rhythm, all clear. Then you have to be away from the victims. Then it will deliver the shock. Then it will promote as continuous CPR. Then you can come back to do CPR. If you can see there's a mark here, there's a one bulge. So that is ICD placement. If you see anyone having ICD, just keep away 10 centimeters from the ICD. So what I was given till now, we will demonstrate on the manicules.
Hi, good afternoon, everyone. My name is Adi Narayan Reddy. I'm a senior paramedic. And I'm working in the High-Tech City next to the branch. And so morning session, I hope and very full each and everyone too helpful. And now presently that is going on and BLS. This BLS we are calling as basic life support. No need to. Okay. And generally, where you are working somewhere in the hospital or in the office and outside the office, in our home or outside the home, or when you are riding the two-wheeler from your home to or going to office, unfortunately, is some accidents happen in front of you, and suddenly someone is collapsed in front of you. What should you do? Direct CPR. So that is the one scenario that is we are calling as an RTA, so road traffic accident. One scenario is that there is in our office there is one building collapse, or just imagine one building has on fire. Yes, those who are the inside the people, they are crying, please help me, help me. To hear that sound. మీరు ఆఫీస్లో ఉన్నారు, పక్కన బిల్డింగ్ ఏదో ఫైర్ అవుతుంది, లోపల నుంచి ఎవరు అరుస్తున్నారు గట్టిగా, హెల్ప్ చేయండి అని. అది మీరు విన్నారు, మీరు ఏం చేస్తారు? అరే బిల్డింగ్ ఫైర్ అవుతుంది చూస్తాను, ఫోటో తీస్తా ఉంటారా? లేకపోతే ఫైర్ అవుతుందని జంప్ చేస్తా అంటారా? ఏం చేస్తారు? డోర్ ఉంటే బ్రేక్ చేస్తారా? Say something, yes or no, no problem. You are not imagine, just you are not hero. Then once you are thinking, I just imagine I'm a hero, once becoming incidents go to the inside, then I will come back to become a zero, right? ఎందుకంటే బిల్డింగ్ ఇక్కడ ఫైర్ అవుతుంది, మనం ఏదో హీరో అని ఎవరు చూస్తున్నారని జంప్ చేద్దామని లోపలికి వెళ్తే బయటకు రాలేదు. ఎందుకు రాలేరు? That scene is not safe. The scenarios are the different. The approaching system is the same. మనం ఇంకా రకరకాలు చెప్పుకోవాలనుకుంటే, ఎవరు వాటర్లో మునిగిపోయారు, వాటర్ డ్రౌన్ అయిపోయారు, హౌ టు సేవ్ దట్ పర్సన్? యు ఆర్ ఆల్సో జంపింగ్ ఇన్సైడ్ ద వాటర్, బట్ యూ డోంట్ నో హౌ టు స్విమ్ ద వాటర్. యు ఆర్ ఆల్సో కాలింగ్ వన్ మోర్ పర్సన్. సో scenarios are the different, that approaching system is the same. So wherever or whenever you are going to save someone, please check the scene is safe or not. మీరు ఎవరికైనా హెల్ప్ చేయాలనుకున్నప్పుడు, అక్కడ బిల్డింగ్ ఫైర్ అవుతున్నప్పుడు మనం వాళ్ళని హెల్ప్ చేయాలనుకున్నప్పుడు అక్కడికి వెళ్ళడానికి అక్కడ సేఫా కాదా ఫస్ట్ చెక్ చేసుకోవాలి. అక్కడ ఫైర్ అవుతుంది, లోపలికి వెళ్తాం మనం, వెళ్ళలేము కదా. అప్పుడు ఏం చేయాలి? దాన్ని ఆర్పాలి. హౌ టు స్టాప్ ద ఫైర్? యు కాల్ సమ్వన్. The reason fire number is there. Call 101, right? Then, some coming to the next topic. There is an accident is there in front of you. Then all the people stop the vehicle and shift the victim to the safest place. Then, what next? See, wherever is there, first step is scene safety. Without scene safety, you can't, you don't approach the victim. Once the scene is safe, then approach the victim. అక్కడ సీన్ సేఫ్ గా ఉందనుకుంటే ఆ పేషెంట్ దగ్గరికి కానీ ఆ విక్టిమ్ దగ్గరికి వెళ్ళండి. వెళ్ళిన తర్వాత ఏం చేయాలి? చెక్ రెస్పాన్స్. నెక్స్ట్ వన్ ఈజ్ చెక్ రెస్పాన్స్. హౌ టు చెక్ ద రెస్పాన్స్? ఎలా చెక్ చేయాలి ఆ పర్సన్ రెస్పాన్స్ లో ఉన్నాడా లేదనేది? మీకు పేరు తెలిస్తే పేరుతో పిలవచ్చు. పేరు తెలియదు అనుకోండి, యూ డోంట్ నో నేమ్, హిస్ నేమ్. హౌ టు చెక్ ద రెస్పాన్స్? హే హే సే లైక్ దట్. ఏమంటాం? తెలియనప్పుడు మనం ఏం చేస్తామంటే ట్యాప్ ద షోల్డర్. హాయ్, ఆర్ యు ఓకే? హలో, ఆర్ యు ఓకే? సే హాయ్, ఆర్ యు ఓకే? మీరు ఏం చేస్తారంటే మన బోత్ హ్యాండ్స్ ని ఈ షోల్డర్స్ ని గట్టిగా ట్యాప్ చేయాలి. మళ్ళీ మధ్యలో చంపలకు కానీ సమ్వేర్ అదర్ పార్ట్స్ ఎక్కడ టచ్ చేయకుండా ఈ షోల్డర్ ని గట్టిగా ట్యాప్ చేయండి. దర్ ఈస్ ఇన్ కేస్ ఇఫ్ దర్ ఈస్ రెస్పాన్స్ ఇస్ దేర్, ఎనీ లెగ్ అప్పర్ లోయర్ limbs movements is there, some you hear the voice is there, it indicates that there is some response is there. అతను ఏదైనా కాళ్ళు చేతులు ఊపుతూ ఉన్నా లేకపోతే వాయిస్ ఏమన్నా ఉంటే రెస్పాన్స్ ఉన్నట్టు. సో దిస్ సినారియో when I am checking the response, there is no response. నేను కొడుతూ ఉన్నా అతను రెస్పాన్స్ ఏమి ఇవ్వలేదు. నెక్స్ట్, వెరీ గుడ్. ఫస్ట్ ఇన్ సేఫ్టీ, నెక్స్ట్ చెక్ రెస్పాన్స్, third one check pulse. At the same time scan the chest also. పల్స్ చెక్ చేసేటప్పుడు నేరుగా మనం ఇక్కడ కూడా చూడాలి. ఎందుకు? బ్రీతింగ్ ఉందా లేదా చెక్ చేయాలి. హౌ టు చెక్ ద బ్రీత్? when they visualize the chest, there is any movements is there or not? మనం అక్కడ చూడాలి. చూస్తే గాలి ఆడుతుంటే ఏమవుతుంది? కిందికి పైకి మూమెంట్స్ ఉంటాయి. ఓకే, how to check the pulse? Already you know that. He said, Dr. Dayakar said, how to check the pulse? Where to check? In unresponsive patient, you don't choose the radial pulse. You are calling as a radial. Okay, radial pulse. This victim in unresponsive, you choose the major pulse, that is called as carotid pulse. దీన్ని మనము carotid pulse అంటాము. ఇది హార్ట్ దగ్గరగా ఉంటుంది కాబట్టి దీన్ని చూస్ చేసుకుంటాం. రైట్, హౌ టు చెక్ ద అంటే 3 fingers తీసుకుంటాం. మిడిల్ ఏముంటుంది? ట్రాకియా ఉంటుంది, గాలి కొట్టమంటాం. మీరు రైట్ కానీ లెఫ్ట్ కానీ, అయ్యో 2 ఉన్నాయి గట్టి 2 పట్టుకుంటారు అనుకోండి, ఒక 4 minutes మీకు కూడా ఇంకోటి రావాలి హెల్ప్ చేయడానికి. ఓకే, సో వెన్ యూ చెక్ ద పల్స్, వీ హ్యావ్ 2 arteries. ఇట్స్ ట్రూ, బట్ యూ చెక్ ఓన్లీ one side, either right or left. Okay, there is a midline. You go to this right or 3 or 4 centimeters down, there is a groove is there. కొద్దిగా లోపల ఉన్నట్టు అనిపిస్తూ ఉంటుంది. కొద్దిగా ప్రాక్టీస్ చేసి తెలుస్తుంది. అయ్యో నాకు పల్స్ రాలేదని ఎట్లనే పట్టుకొని కూర్చున్నారు అనుకోండి, పుణ్యకాలం అంతా వేస్ట్ అయిపోతుంది. సో ఇక్కడ ఈచ్ సెకండ్స్ ఇట్స్ వెరీ వెరీ ఇంపార్టెంట్. సో వెన్ యూ చెక్ ద పల్స్, ఇఫ్ యూ సస్పెక్ట్ దర్ ఈస్ నాట్, యూ నాట్ ఫీల్ ద పల్స్, మీరు ఇక్కడ పల్స్ లేదనిపిస్తుంది అనుకోండి, నో ప్రాబ్లం, లీవ్ ఇట్. ఎంతసేపు చెక్ చేస్తాం మనం పల్స్ ఇక్కడ? 5 to 10 seconds, నాట్ మోర్ దాన్ 10 seconds. 5 నుంచి 10 సెకండ్లు చెక్ చేస్తాం, అంతకంటే ఎక్కువ చెక్ చేయం. ఓకే, సస్పెక్ట్ ఫీల్ కాలేదనుకోండి, వదిలిపెట్టండి. వన్స్ యూ కన్ఫర్మ్ వితౌట్ పల్స్, దర్ ఈస్ నో పల్స్, ఇమీడియట్లీ కాల్ ఫర్ హెల్ప్. ఇట్ ఈస్ వెరీ వెరీ ఇంపార్టెంట్. వేర్ యు ఆర్ దేర్, వన్స్ యూ ఫేసింగ్ ఎనీ ఎమర్జెన్సీ, ప్లీజ్ కాల్ ఫర్ హెల్ప్. గుర్తుపెట్టుకోండి, ఇది మీరు ఎక్కడన్నా ఉండండి, ఏదైనా మీకు ఎమర్జెన్సీ అనిపిస్తుంది అనుకోండి, ఇమీడియట్గా కాల్ ఫర్ హెల్ప్ చేయండి. యువర్ అలోన్, మీరు ఒక్కరే ఉన్నారు, మీకు ఇంకా ఇద్దరు తోడయ్యారంటే ఏమవుతుంది? హెల్ప్ఫుల్ కదా. సో అందుకని ఏమంటున్నా అంటే ఏదైనా ఎమర్జెన్సీ అన్నట్టే ఇమీడియట్లీ కాల్ ఫర్ హెల్ప్. మరి ఎవరు చేయాలి కాల్ ఫర్ హెల్ప్? మనం ఇక్కడ మీ ఆఫీస్ దగ్గర ఒక యాక్సిడెంట్ అయిందండి, వాడు ఎవరో మీకు తెలియదు, అన్నోన్ పర్సన్, మీరు ఏ హెల్ప్ చేయాలనుకుంటున్నారు, ఎవరికి కాల్ చేస్తారు? ఫ్రీ అంబులెన్స్ సర్వీస్ ఉంటుంది ఇక్కడ. ఏముంటుంది నెంబర్? అది 108 అంటారు. మనం 108 ఫోన్ చేసేసి మనం డిస్టిక్, ఏరియా, లోకల్ చెప్తే వాళ్ళు ఆ అడ్రస్ ఖచ్చితంగా చేరుకుంటారు. బట్ 108 సర్వీసెస్ ఈజ్ నాట్ అవైలబుల్ ఆల్ ఓవర్ ద ఇండియా. ఈ 108 సర్వీసులు కొన్ని స్టేట్స్లో ఉన్నాయి, అన్ని స్టేట్స్లో లేవు. అందుకని సెంట్రల్ గవర్నమెంట్ మనకి ఏం చెప్పింది, నేషనల్ డిజాస్టర్ నెంబర్ ఒకటి ఉంటుంది, ఆల్రెడీ మీకు తెలుసు. అది ఏంటది? 112 అనేది అది అవర్ నేషనల్ డిజాస్టర్ నెంబర్. ఆ నెంబర్ కాల్ చేయొచ్చు. తర్వాత మనం ఏం చేయాలి? ఇక్కడ నేను సినారియోస్ని కొద్దిగా డిఫరెంట్ మాడిఫై చేస్తాను. మనం ఇక్కడే ఉన్నాం, ఆల్ ఆర్ ద హియర్ ఓన్లీ. మిడిల్ ఆఫ్ ద పర్సన్, వన్ పర్సన్ కొలాప్స్ ఇన్ ఫ్రంట్ ఆఫ్ యూ. ఏం చేస్తాం? వీ హ్యావ్ ఏఈడి విత్ సెక్యూరిటీ. కొన్ని చోట్ల కమ్యూనిటీస్లో ఏముంటుందంటే ఏఈడి మిషన్ ఉంటుంది ఒకటి. సో ఏఈడి ఉందనుకోండి, మనకి ఇక్కడ ఎవరు కొలాప్స్ అయ్యారు, రెస్పాన్స్ చెక్ చేసాం, నో రెస్పాన్స్, పల్స్ చెక్ చేసాం, నో పల్స్, ఇమీడియట్గా మనం కాల్ ఫర్ సెక్యూరిటీ అంటాం. ఇక్కడ లోకల్ ఈ ఆఫీస్ చెప్తున్నాను, అతని దగ్గర ఏముంటుందంటే ఏఈడి ఉంటుంది. మనం ఇమీడియట్లీ గెట్ అయిన ఏఈడి ఇది ఆడిటోరియం అని చెప్తాం, రైట్? తర్వాత మనం ఏం చేయాలి ఇక్కడ? ఇమీడియట్లీ స్టార్ట్ సిపిఆర్ అన్నాం. సిపిఆర్ అంటే ఏంటి? కార్డియో పల్మనరీ రీససిటేషన్ అంటారు. సో ఇన్ అన్రెస్పాన్సివ్ స్టేట్ there is no any function, any organ in the human body. So in case when you are recognizing that this patient is going to arrest, how to check the arrest? Check response, no response, check the pulse, no pulse, immediately call for help, get an AED, then you start the CPR. How to start the CPR? With help of your hands. See, in this BLS session, there is no any involvement of medical devices. ఇక్కడ మనకు దీంట్లో ఎక్కడ కూడా హాస్పిటల్లో ఉన్నటువంటి మిషన్స్ ఇక్కడికి ఏవి రావు. మరి ఇక్కడ ఏం చేస్తాం? కొద్దిగా బుర్ర ఉపయోగించాలి. యూజ్ యువర్ బ్రెయిన్ అండ్ యూజ్ యువర్ హ్యాండ్స్. సో యువర్ కాలింగ్ యాజ్ ఏ 2 hands టెక్నిక్ ఓన్లీ టు సేవ్ ద లైఫ్, రైట్? వేర్ ఇస్ ద ప్లేస్మెంట్? ఎక్కడ మనం సిపిఆర్ చేయాలంటే ఏం చేయాలి? హ్యాండ్స్ ఉండాలి ముందు. మనకు హ్యాండ్స్ లేకపోతే ఏం చేయలేము, రైట్? ఫస్ట్ ఏదన్నా కానీ రైట్ కానీ లెఫ్ట్ కానీ హ్యాండ్ తీసుకోండి. ఈ భాగం మాత్రమే, ద హీల్ ఆఫ్ ద హ్యాండ్, నాట్ కంప్లీట్ హ్యాండ్, హీల్ ఆఫ్ ద హ్యాండ్, ద ప్లేస్ ఇన్ ద బిట్వీన్ ద 2 nipple line ఆర్ సెంటర్ ఆఫ్ ద చెస్ట్. ఈ చెస్ట్ కు మధ్య భాగాన ఈ భాగాన్ని ఉంచాలి. ఉంచిన తర్వాత ఈ హ్యాండ్ ఏం చేయాలి? విత్ హెల్ప్ ఆఫ్ ద ఫింగర్స్, ఈ వేల సహాయంతో దీన్ని ఇంటర్లాక్ చేస్తాం. దీన్ని లాక్ చేయాలి. దీన్ని కాలింగ్ ఇంటర్లాకింగ్. దెన్ ప్లేస్ ఇన్ ద బిట్వీన్ ద 2 nipple line, the center of the chest. My hands, my elbow should be straight, like a 90-degree angle. నా చేతులు ఎలా ఉండాలి? నిలువుగా ఉండాలి, ఇట్లా ఏటవాలుగా ఉండకూడదు. వై నాట్ 45? ఇట్లా బెండ్ ఎందుకు ఉండకూడదు? ఈ సింపుల్ టెక్నిక్ అది. ఎందుకంటే నేను ఇలా చేస్తే ప్రెషర్ ఎలా ఉంటుంది, ఇలా 90 degree పెడితే నా హోల్ బాడీ వెయిట్ అంతా కూడా నా షోల్డర్ మీదకి వస్తుంది. సో అందుకని ఎప్పుడైనా సిపిఆర్ చేసేటప్పుడు జనరల్గా మీరు చూస్తూ ఉంటారు ఎలక్ట్రానిక్ మీడియాలో, ప్రింట్ మీడియాలో, అక్కడక్కడ ఎవరో పడిపోయారు, అక్కడ ఎవరో మళ్ళీ అతను వచ్చారు, ఏమో చేశాడు, కొద్దిసేపటికి అతను కాన్షియస్కి వచ్చారు అని, రైట్? ఇలాంటి సినారియోస్ అప్పుడప్పుడు అక్కడ జరుగుతూ ఉంటాయి. సో చేసేటప్పుడు కొంతమంది ఆటోలు కూర్చోబెట్టుకొని ఒకడు ఏదో ఇట్లా నొక్కుతూ ఉంటాడు, ఆటో రన్ అవుతూ ఉంటుంది. సో దట్ ఇస్ నాట్ గుడ్. సిపిఆర్ చేసేటప్పుడు పేషెంట్ని హార్ట్ సర్ఫేస్లో ఉండాలి. మేము హాస్పిటల్స్లో బెడ్స్ ఉంటాయి కదా, మా దగ్గర కూడా, మనం గట్టిగా ప్రెజర్ ఇచ్చామనుకోండి, ఆటోమేటిక్గా మన ప్రెజర్ ఏమవుతుంది? ఆ బెడ్ కూడా డౌన్ అవుతూ ఉంటుంది. సో అందుకని మనం అక్కడ హార్ట్ సర్ఫేస్ కావడానికి మా దగ్గర కట్బోర్డ్ షీట్ ఉంటుంది, హార్ట్ సర్ఫేస్ ఆ బోర్డు పెడతాం కింద, పేషెంట్ కింద పెట్టేసి మేము తర్వాత సిపిఆర్ స్టార్ట్ చేయడం జరుగుతుంది. అందుకని మనం ఇండ్లలో ఎవరన్నా ఉంటే ఇలా చేయాలి అనుకున్న సిచ్యువేషన్ వస్తే పేషెంట్ షిఫ్ట్ చేయండి డౌన్కి. డౌన్ షిఫ్ట్ చేసిన తర్వాత మాత్రమే మనం ఇక్కడ సిపిఆర్ చేయాలి, రైట్? దీన్ని నేను ఏమంటా అంటే కంప్రెషన్ అంటాను. ఈ సిపిఆర్ని ఒకదాన్ని, సో ఇది మ్యాన్కిన్ కాబట్టి మనం ఈ డెమో మనం ట్రైన్ చేసేటప్పుడు ఇది వాళ్ళు ఏం చేస్తారంటే, ఓకేనా, రైట్? ఎస్ సార్ చెప్పండి, పర్లేదు, ఏం కాదు. ఏం మాకేం తెలుసు అండి మీరు మమ్మల్ని అడిగితే అంటారా? See, each compression should be going to around 5 centimeters depth. ఇటు గట్టి నొక్కేది ఏం చేయాలి అంటే ప్రతి ఒక్కటి 5 centimeters డౌన్ వెళ్ళాలి. అప్పుడే ఏమవుతుందంటే హార్ట్ లో ఉన్న బ్లడ్ బయటికి రిలీజ్ అవుతుంది. సో ఇది మ్యాన్కిన్ కాబట్టి మనం 5 centimeters డెప్త్ వెళ్తే ఒక సౌండ్ వస్తుంది చూడండి, రైట్? వీ నీడ్ దిస్, ఇలా సౌండ్ రావాలి చూడండి. 1 2 3 4 5 20 25 30 అయిపోయాయా? 30 అయిపోయాయా? వినిపించిందా? 30 అనేది వినపలేదా? ఓకే, 30 కంప్రెషన్స్ కావాలి. హౌ మెనీ? అందుకే ఇక్కడ యూనివర్సల్ రేషియో ఉంటుంది, 30:2 అంటాం. ఈ 30 అనేటివి కంప్రెషన్స్ అంటాము. 2 ఏంటివంటే ఆక్సిజన్ ఇవ్వాలి. ఎలా ఆక్సిజన్ ఇస్తాం మనము? 30 అయిపోయిన ఇమీడియట్ గానే ఈ పేషెంట్ ని తల కిందికి అనాలి, ఈ చిన్ పైకి అనాలి. దీన్ని హెడ్ టిల్ట్, చిన్ లిఫ్ట్ అంటాం. హెడ్ టిల్ట్ అంటే హెడ్ కిందికి, చిన్ పైకి. మళ్ళీ నోస్ క్లోజ్ చేయాలి, మౌత్ ఓపెన్ చేసి 2 బ్రెత్స్ ఇవ్వాలి, అంటే 2 times ఆక్సిజన్ ఇవ్వాలి. మీరు పైనుంచి అన్నారు పోయింది ఆక్సిజన్ లోపలికి కదా. మనం మౌత్ టు మౌత్ టచ్ చేయాలంటే చాలా ఇంట్రెస్ట్ కదా అందరికి కదా. కానీ కరోనా వచ్చినప్పటి నుంచి మౌత్ టు మౌత్ ఎవరు టచ్ చేయండి కదా. అందుకని మనం ఏం చెప్తుంటే ఒక బ్యారియర్ యూజ్ చేయాలి, ఏదైనా కర్చీఫ్ కానీ. హాస్పిటల్ సెట్టింగ్స్లో అయితే మాస్క్లు ఉంటాయి, ఫేస్ మాస్క్ అని, అంబు బ్యాగ్స్ అని ఉంటాయి. సో మనం ఇక్కడ ఉన్నాం కాబట్టి అలాంటి మన దగ్గర ఫెసిలిటీ ఉండదు. సో అందుకని 30 కంప్రెషన్స్, 2 వెంటిలేషన్స్, ఇది ఒక సైకిల్. ఇది గుర్తుపెట్టుకోండి, 30 ఇవ్వాలి, తర్వాత 2 times మనం గాలి ఇవ్వాలి. దాన్ని ఒక సైకిల్ అంటాం. ఇలాంటి సైకిల్స్ మనకి ఎన్ని కావాలి? 5 cycles కావాలి. ఒకవేళ టైం మీరు క్యాలిక్యులేట్ చేసుకుంటే 2 minutes అవుతుంది. ఓకే, సో ఆఫ్టర్ 5 cycles తర్వాత ఏం చేయాలి మనం? ఇదే పనేనా? ఒత్తుకుంటా ఉండేది, గాలి ఇచ్చుకుంటా ఉంటామా? అంటే ఆఫ్టర్ 5 cycles తర్వాత మళ్ళీ పల్స్ చెక్ చేయాలి. ఎప్పటికి 5 cycles తర్వాత, ఫస్ట్ సైకిల్ వద్దు, మధ్యలో ఏ వద్దు, 5 cycles తర్వాత. లేదంటే 2 minutes ఎవరైనా అన్నారనుకో, 2 minutes తర్వాత పల్స్ చెక్ చేస్తాం. స్టిల్ పల్స్ ఆబ్సెంట్, పల్స్ లేదు, కంటిన్యూ కంప్రెషన్స్, కంటిన్యూ సిపిఆర్. ఒక సైకిల్ మాత్రం మూవ్ అవుతూ ఉంటుంది. ఇన్ కేస్ ఆల్రెడీ కాల్డ్ సమ్వన్, ఏం చెప్పాము మనం? కాల్ చేసాము ఎవరికి? ఎయిడ్ తీసుకురా అని. ఫర్ ఎగ్జాంపుల్ జస్ట్ ఇమేజిన్, మీ దగ్గర ఎయిడ్ ఉందనుకుంటున్నాను నేను, కాల్ చేశాను, వాడు ఎయిడ్ తీసుకొని వస్తాడు. వాడు తీసుకొచ్చాడనేసి మనం స్టాప్ చేయకూడదు, ఇతని పని కంటిన్యూ చేస్తూనే ఉంటాడు. ఓకే, ఇప్పుడు ఇక్కడ సిపిఆర్ రన్ అవుతూనే ఉంది, జస్ట్ ఇమేజిన్ రన్ అవుతుంది, ఏఈడి వచ్చింది. సో ఏఈడి అంటే దీన్ని ఆటోమేటెడ్ ఎక్స్టర్నల్ డిఫిబ్రిలేటర్ అంటారు. ఏమంటారు? ఆటోమేటెడ్ ఎక్స్టర్నల్ డిఫిబ్రిలేటర్. నువ్వు నువ్వే చెప్పుకో బాబు, మళ్ళీ మాతో రిపీట్ ఎందుకంటారా? కొంచెం చిన్న పదాలు ఇవి నేర్చుకోండి, పర్లేదు. ఇది ఏం చేస్తుంది అంటే, ఏదైతే రిథం అబ్నార్మల్ గా వెళ్తూ ఉంటుందో, రిథం అంటే ఏం లేదు, గుండె కొట్టుకునేదాన్నే రిథం అంటాం. సో జనరల్ గా మనకు హార్ట్ పంపింగ్ ఇలా జరుగుతుంది, ఇలా క్లోజ్ అయ్యి మళ్ళీ ఓపెన్ కావాలి. కానీ ఒక్కొక్కసారి హార్ట్ ఇలా కొట్టుకుంటా ఉంటుంది, పైన తిరుగుతాం, ఇది అబ్నార్మల్ రిథం అంటాం. దాన్ని ఏం చేస్తాం? ఇమ్మీడియట్ గా మనం స్టాప్ చేస్తాం. ఇంగ్లీష్, హిందీ లేదు. Then, so what is the main function of this mission ante? It is recognize the abnormal rhythms, then to control the abnormal rhythms. How to control? It's giving it to the shock. it's given to the victim. How to deliver? Automated. It's calling as a AED, automated external defibrillator. So how to operate? First, you know that how to operate this machine. So there is one button is there here. Once press the button,
dry pads to patient's chest. Flashing the light. Connector.
yes, plug-in connector.
Analyzing heart rhythm. Do not touch the patient. Analyzing interrupted. Do not touch the patient. Shock advised. Charging.
Now
Stay clear of patient. Deliver shock now. Press the orange button now.
there is one blinking, when light is coming. This is the orange button. See what he's saying that
Deliver shock now. Press the orange button now.
it's analyzing the rhythm, it is the shockable rhythm to deliver the shock. Just advice. Just press the orange button.
Shock now. Press the shock delivered. 4. Start
Now-
CPR.
Then immediately start the CPR. Right? So turn on the button, apply the pads and plugging, then analyzing the rhythm. Don't touch the patient when it is analyzing the rhythm. Then it is a detected. So it is a detected, it is a shockable rhythm or non-shockable rhythm. Okay, we have only two rhythms we are going to deliver the shock. One is VT and second one is VF, ventricular fibrillation. So fibrillation ante entante generally the heart rhythm is like that. Now the fibrillation, this is the fibrillation. Okay, and VT without pulse, ventricular tachycardia. These two rhythms only you are going to deliver the shock, right? You know how to use the AED, and where the we have two sets of pads. Is there one is the pediatric, one is for pediatric, one is for adult. So where to place the pads? There is no confusion. There is a marking is there here, red marking. One is right side below the right collarbone. One is the left side below the axillary, mid axillary line, right? Then, and there is some those who have this is AD before slide. Next one. Next. Stop it. Back, come back. Back. See, there is a, what is this? We don't know. We don't know. There is something is there. Okay. Generally, this patient, there is a pacemaker is there. So when you are delivering the shock, don't apply the pads over the pacemaker. Okay, just apply the pads above or below, away, okay, from the pacemaker. What happened? These pads apply over the pacemaker when delivering the shock. What happened? That mission, it's working. Okay, when deliver the shock and over the mission, it's going to damage. It's not working properly. So that when you identify these kind of scenarios, just below or above, then away, you place this kind of pads. And next, after 5 cycles, you check the pulse. There is no pulse. In meanwhile, the AED is the came. Then one person continues the CPR. Once the AED says that, now I am going to analyzing the rhythm, don't touch the patient, stop the CPR. And it indicates that don't touch the patient, stop the CPR. Then it is indicating that is analyzing the rhythm, it is a shockable rhythm to deliver to shock. It's advised to deliver the shock, then deliver the shock. Then again it says that restart the CPR or resume CPR. Then immediately start the CPR. Okay. After 5 cycles, then check the pulse. In case the pulse is present, stop the compression, turn the patient into the left lateral position. Okay, left lateral position. In case now the heart is working now, slowly the working remaining organs also. There is the saliva secretions are releasing in the mouth. When they turn the patient left side, that drain is coming to out. In case the pulse is present, the victim is same position like this supine position, your saliva kills silently. So that saliva, the patient is not fully not conscious. So that saliva is going to where? In stomach or lung? The stomach is the saliva going to lungs only. That's going to aspirate. So that is also you're facing big problem. So please avoid that. Once finding that recognize the pulse is present, stop the compression, turn the patient into the left lateral position. Right? Any doubts? No doubts. Doubts ఏంటి ఉంటాయండి మీరు చెప్పేసి వెళ్ళిపోతే మా పని మేము చేసుకుంటామంటారా?
But there are some special circumference. You know, in our family, so our grandparents might be having diabetic or hypertension. For example, in some scenarios, the patient pulse will be present. Mostly in diabetic patient we see, but there might be an unresponsive state. So for them at home, they will have glucometer. They will check regularly before taking insulin shots. You know, sometimes they might not take proper food, or unwantedly they might inject more insulin. In those scenarios, the glucose level will come down. In that case also the patient look like unresponsive state only, but there will be pulse present. In them, check the glucose first. Do not start CPR, so and so things. Check the glucose, they will have the glucometer at home. If there is low sugars, try to give any sugar syrup or meanwhile coming to the hospital, below the tongue, any crystal, chocolate or sugar syrup, not directly into the nose. Because they also look like unconscious patient only if sugar levels are too low, if BP is too low. So don't start CPR if there's a pulse. First, they will have mandatory glucometer, check the sugars, bring them to the hospital. Meanwhile, when you're getting the patient to the hospital, try to give any crystals below the tongue.
Is there no issues? If we are afraid, we have the panic at a time, anywhere, you call for help. Okay. So, nowadays, each and everyone had to suffer diabetes, hypertensive, something. Okay. So our grandma or grandfather is there. When you wake up in early morning, is not responding. Then approach the victim, tap the shoulder. Hello, Nana. Hello, Nana. Nana is not responding. When they check the pulse present. When they check the breathing present. Okay. Already you know that this patient, diabetic patients. Once check the glucose levels, the reading it shows that between the 30 to 20, 30 to 40, like that only. So in these ranges, the patients look like a unresponsive state. They're not responding. Okay. Once you recognize that this is low sugars is there, immediately to give the sugars, how to give? Don't give the liquids. To give any chocolate jellies is there, the place under the tongue, not above the tongue, under the tongue. After 20-25 minutes, it slowly dissolves. The patient slowly, once is coming to the conscious, slowly open the eyes. In case you are panic, call for help, immediately shift the nearest to the hospital. Right? Yes, coming to the pediatric. See, adults, children, pediatrics. In 3 categories, same to same, check the response, placement of hands, and see how many that compressions under 30:2. Fix. But coming to children, sorry, not children, pediatrics or infants. Here, this is an infant. Just imagine this is he is an infant. Then how to check the response? మన చిన్న పిల్లలకి ఏం చేస్తాం రెస్పాన్స్ అంటే ఇట్లా టచ్ చేస్తే ఏం చేస్తారు పిల్లలు ఇస్ ద మూవింగ్ అవునా లేదా సో జస్ట్ ట్యాప్ ద ఫీట్ ఆఫ్ ద సోల్ రైట్ దెర్ ఈస్ నో రెస్పాన్స్ వాట్ నెక్స్ట్ మై క్వశ్చన్స్ కమింగ్ సేమ్ స్టోరీ నెక్స్ట్ రెస్పాన్స్ ఓవర్ నెక్స్ట్ చెక్ ద పల్స్ where to check the pulse
In pediatrics, in children.
okay no idea we have children okay in your office అయిపోయిన తర్వాత ఇంటికి వెళ్ళిన తర్వాత పిల్లలు చెక్ చేయండి just keep in observe there is no space between light మనకి ఎంత స్పేస్ ఉంటుందో పిల్లలకి అంత స్పేస్ ఉండదు there is no space in compared to the adult so here you have checked that there is one more pulse is there here you are calling as a brachial pulse okay మళ్ళీ టచ్ చేస్తే వినిపిస్తుందా సార్ మనకి పల్స్ ఫీల్ అవుతామా అంటే చాలా కష్టం కొద్ది ప్రాక్టీస్ ఉంటేనే వస్తుంది రైట్ సేమ్ టు సేమ్ జస్ట్ ఫాలో ద టైమ్ 5 to 10 seconds not more than 10 seconds okay there is no pulse what to do scene safety check response no response check pulse no pulse నాకు తెలిసి మీరు సిపిఆర్ అంటారని కూడా సిపిఆర్ అంటే ఫాస్ట్ గా రెడీగా ఉన్నట్టున్నాం మనం కదా కాల్ ఫార్ హెల్ప్ ద ఫస్ట్ మెడిసిన్ ఈస్ ద ఆక్సిజన్ ఫర్ ఎవరీ కేసెస్ ఎవరీ డిసీజ్ రైట్ మన ఇంట్లో ఉంటుంది ఆక్సిజన్ ట్యాంక్ ఉంటుందా సో కాల్ ఫార్ సమ్ వన్ రైట్ దెన్ సి కాల్ ఫార్ సమ్ వన్ నెక్స్ట్ కమింగ్ టు ది next step in CPR. How to deliver the CPR in neonates in pediatrics? Here there is a 2 type of CPRs. One is 2-finger technique. Same placement, center of the chest only, but use only 2 finger. 1, 2. Okay. There is a second step. Hold the baby like this and use 2 thumb encircling method. 2 thumb 1, 2, 3, 4, 5, 6 same to same. How many? 30. Right. Now we have 2 rescuers is there. We have 2 rescuers. మనం ఇద్దరు హెల్ప్ చేయడానికి ఇక్కడ ఒకరే ఉంటే అందరికి 30:2 ఫిక్స్ నో డౌట్ at all. There is a 2 rescuers is there, especially in neonates. You follow 15:2. How many? 15:15 compressions, 2 ventilations. I don't know how to deliver the compression ventilations. Nothing, no problem. To deliver compression only is enough. Give 30 compressions. Leave it 1 or 2 seconds. Again to restart. After 5 seconds. After 5 cycles, what to do? Very good. Check the pulse. If there is no pulse, the continue compressions. Right? Now, okay. This is those who are recognizing unresponsive adults, children in pediatrics. How to save their lives without any medical equipment. Right? So there is a 2 scenarios. The one is witness arrest. Second one is unwitnessed arrest. Witness, it means you are a witness. Someone is asking like that, you are a witness. What do you mean? అంటే నువ్వు విట్నెస్ అంటే దాని అర్థం ఏంటి నువ్వు చూసావా అని నువ్వు చూసావా నీ ముందర జరిగిందా అని ఎస్ నా ముందరే జరిగింది నేనే విట్నెస్ అంటాం So once you recognize someone is collapsed in front of you, immediately start. What start? Scene safety, check response, no response, check pulse, no pulse, call for help, start the compressions. Okay, 100% that person is coming to back. Okay, in hospital scenario, in hospital settings, we have a team, 6 members to fight. 6 members fight చేస్తా ఉంటాం. One is going to medications, one is going to shock. There are 2 or 3 members going to deliver the compressions. So then already in the morning, doctor says that regarding our what is cardiac arrest, how to treat, how to preventable. See, if not treated properly, what happened? Coming to this stage, tap the shoulder, check the pulse, start the compressions. Okay, how to recognize this patient is suffering chest pain? What are the symptoms of chest pain? See, there is a bhaiya, if not interested, please go out. See, someone is holding this chest. They are saying that clearly there is some pain is coming here. That is one symptom. Second one is profuse sweating. Drugs could total that's point total. Shortness of breath is a difficulty breathing, giddiness, palpitations. Okay, that pain is going to somewhere. We are calling as a pain radiating to lower arm. Pain is going to radiate to back, radiating to up. These are all the symptoms related to the cardiac chest pain. Okay. One day, one 90 years female, she finished the bath. They are complaining to the family members. I have ear pain, severe ear pain. She came to emergency. I am asking what happened. She said, severe ear pain is there. I told to sister, take it on ECG. Take the ECG. ECG shows that, it says that we are calling as a MI, myocardial infarction అని చెప్తాము. దాని చెస్ట్ పెయిన్ అని చెప్తాం. అప్పుడు ఆమెకి చెస్ట్ పెయిన్ ఉంది. Then, but it is not cardiac center. We are referring to the other cardiac center. After 10 days, she came to say, she is appreciating to me. You are giving a good decision. You are giving good suggestion and all. He is saying something. Okay, okay, thank you, thank you. Age is 90 years. She is complaining. ఏం కంప్లైంట్ చేస్తా ఉంది? ఇయర్ పెయిన్ కంప్లైంట్. మనం ఏమనుకుంటాం? నీకేమైనా లోపల ఏమైనా ఉందో క్లీన్ చేసుకోమని. అవునా కదా? అంటే జనరల్. సి ఇక్కడ హార్ట్ రిలేటెడ్ అంతా కూడా ద పెయిన్ ఈజ్ రేడియేటింగ్ టు సమ్వేర్. Some patients complaining ear pain, some patient complaining to back, or some patient ఇంకా ఏం చెప్తారంటే పేషెంట్స్ చెయ్యి గుంజుతా ఉంది, లాగుతా ఉంది, ఇలా చెప్తూ ఉంటారు. దిస్ ఆర్ ఆల్ ఆర్ అండర్ కమింగ్ టు ది చెస్ట్ పెయిన్ అండి. కొంతమంది వాళ్ళంతా వాళ్ళే డిసైడ్ చేస్తారు. ఎస్టర్డే ఐ ఈట్ లాట్ ఆఫ్ మసాలాస్, బిర్యానీ, అండ్ నెక్స్ట్ డే మార్నింగ్ దే ఆర్ బర్నింగ్ హియర్. జనరల్లీ వీఆర్ కాలింగ్ యాజ్ ఏ gastric pain. Simply you are saying you are a decision, you are diagnosed gastric pain. Don't take silly. ఇదంతా ఈజీగా తీసుకోకండి. You are not a decider. So once you take one small ECG, okay, ECG తీసుకున్నారనుకోండి, that is the first line ECG. It is a cardiac or non-cardiac. Okay. Then what is on brain stroke? You know brain stroke? What doctor told morning? Golden hour. Okay. A golden hour లో వచ్చారనుకోండి patient, you treat that patient. You are finding any thrombosis there, you are the thrombolysis through the help of some medications, right? Then coming to the brain stroke. What is brain stroke? How to recognize, how to identify? This patient is generally you are calling as a fits, sorry, not fits, paralysis. Paralysis antam. So how to recognize? There is simple 3 symptoms. One is ask the patient name. What is your name? Ante, the word is not coming clearly. And I say, one, just ask the laughing. ఒకసారి నవ్వమని చెప్పండి. జనరల్ నవ్వుతూ ఎలా ఉంటాం మనం? ఇలా ఉంటామా? అక్కడ సఫర్ అయ్యే వాళ్ళు ఏమవుతారంటే ఇలా ఉంటారు. ద మౌత్ డివైడింగ్ టు వన్ సైడ్. వాళ్ళు నవ్వుతే ఏమవుతుందంటే ఈ మౌత్ ఒక సైడ్ పక్కకి వెళ్ళిపోతూ ఉంటుంది. దట్ ఈస్ సెకండ్ సిమ్టమ్. థర్డ్ సిమ్టమ్, జస్ట్ బోత్ హ్యాండ్స్ పైకి లేపమనండి. టు రైజ్ అప్ యువర్ హ్యాండ్స్, బట్ వన్ హ్యాండ్ గోయింగ్ టు డౌన్. These based on 3 symptoms, this patient suffering brain stroke or paralysis. Okay, once recognized these symptoms, immediately shift the nearest to the, not hospital, the nearest to the multi-specialty hospital. We need MRI, we need CT scan. These facilities available, which hospital is available, to shift that patient only. Then immediately finish the scan, you identify the some clots in the brain. Which plan? The right hand going to down. So which part is damaged in the brain? Left only. Okay. As early as possible, to immediately involve the neurophysicians, neurosurgeons and all. Then finding that location within hours, thrombosis or clotting.
Most commonly we will see in high blood pressures. There is a golden period which we call it as 4.5 hours. If you get the patient within 4.5 hours, high chances of getting back their movements will be more. The delay of the time, the prognosis will be very bad. So there will be 2 types. One will be infarct, one will be hemorrhagic. Infarct ante brain lo clot aitadi. Adi mem 4.5 hours lopata, if you get that patient, we do one CT or MRI. If it is an infarct, we do thrombolysis. So the golden period for thrombolysis will be 4.5 hours. ఆ లోపల తీసుకొని వస్తే high chances of recovery will be more. If you delay the time, ఎంత డిలే చేసుకుంటే వెళ్తే the prognosis will be that worst. So 4.5 hours లోపల తీసుకురండి. So that too nearby any big hospital. If you go and wasting time to small hospitals, the chances of getting time will be delay will be more. The other one is bleed. So in case వాళ్ళలో bleed ఉన్న వాళ్ళలో ఏమైతే అంటే bleed ఎక్కువైంది అనుకోండి, the prognosis will be very bad. In that case we do CT, we see the bleed, how much effect it is getting on the other side. Based on that, we plan for we call for neurosurgeon help. They'll take to the OT, they will take which side is affected, they will take the scalp, they will release the pressure. So in this case, in this stroke scenario, the time period will be more important. The delay, if you do, the prognosis will be very bad. If you get within the period, the chances of recovery will be more.
So you are calling as a window period. In cardiac, golden hour. In paralysis, window period. Okay. So anyone to practice on mannequin, please come.
Do you have any other doubts? You can ask us. If not, you can practice on the manicure.
Yes, ma'am. Please ask, ma'am.
Seeing at once, that you just as if you're throwing up from your intestine. If you do that, you can save the time, they're saying. Is that true?
No, it's not. If you like to practice on this manicure, you can come forward, because the lecture can be given by everyone, everywhere. You can listen. Unless you practice, you will come to know the steps. But if you don't need to remember theory also, that will be fine when you have more work experience.
ये पेरो ये नाम क्या रंजित रंजित ओके रंजित भैया हाँ इज समवन इज अनरेस्पॉन्सिव क्या करना फर्स्ट स्टेप क्या करना फर्स्ट स्टेप सीन सेफ्टी वो सीन अच्छा नहीं है ओके सीन सेफ्टी है सेकंड स्टेप जाओ पेशेंट के जाओ okay I will show you one more time okay no problem just see first one is scene safety now the scene is safe now here then I am going approaching the victim then I am checking the response hello are you okay hello are you okay patient is not responding then check the pulse there is no pulse at the same time scan the chest there is no any chest movements immediately call for help then start the compressions 1 2 3 4 5 20 25 30 after 30 give 2 rescue breaths open the airway head tilt chin lift ऐसा okay जाओ तो रेस्पॉन्स चेक करो कैसे रेस्पॉन्स चेक करना नो नो फर्स्ट हाँ ऐसा मारो जोर से आर यू ओके हाँ नो रेस्पॉन्स हाँ हाँ पल चेक करो ऐसा ऐसा है बताओ ऐसा तीन फिंगर ले लो तीन इधर से रोको 10 seconds ओके नाउ नो पल्स क्या करना पल्स नहीं है तो फिर ओके वो कॉल फॉर हेल्प 112 और 108 हाँ ओके फिर CPR स्टार्ट करना मार ऐसा ऐसा वो सेंटर हो ना ऐसा ये वाला इधर रखो ये हैंड से हाथ इंटरलॉक करो वो सामने आओ ये वाला पूरा 90 डिग्री होना वो स्ट्राइट होना हाँ मार 1 2 3 बेंड नहीं है 1 2 3 4 5 6 7 8 9 10 11 20 25 30 आफ्टर 30 क्या करना 2 टाइम श्वास देना दे ऐसा ओपन करो हेड टिल चिन लिफ्ट मत ऐसा क्लोज करो ऐसा ऐसा ये हाथ में हाँ 2 टाइम श्वास ले लो ऐसा दे नीचे जाओ माथ में रखो बस ले ओके अगेन फिर CPR बना एक ही साइकिल हो गया 5 साइकिल्स बना हाँ 5 साइकिल्स होने के बाद क्या करना पल्स चेक करना पल्स है तो क्या करना CPR नहीं देना ओके पल्स नहीं आते CPR कंटिन्यू करना ओके मार फाइन बोलो 30 बोलो ओके जोर से बोलो 30 हो गया ओके चलो थैंक यू ఓకే ఎనివన్ సార్ టైం అయింది సార్ వెళ్ళిపోతాం సార్ అంటారా ఓకే థ్యాంక్ యూ
Good afternoon, everyone. So thanks for your patience. One last session, sir. Today we have with us Dr. Pradeep Karmanchi, Senior Consultant Radiation Oncologist, who is practicing at National Hospital, Somajguda and High-Tech City. Today, it's a take a privilege to introduce him, and he will be going to explain regarding the oncology, I mean cancer, symptoms of cancer, causes, and preventive measures. So please welcome Dr. Pradeep sir on the stage, please. Sir, please come.
No problem. That's yeah. So good afternoon, everyone. I'm Dr. Pradeep Karumanchi, consultant radiation oncologist from Yashoda Hospital, Somachiguda. And myself, I did my medicine from Usmania, then worked in Sloan Kettering Cancer Center in the Cornell University in USA, then completed my precision oncology from Geneva and thoracic oncology from Michigan. Later, I joined Army for 2 years. Then I shifted back my practice to community level in Bangalore. I was in HCC Cancer Center for almost 4 years. Then shifted back to Pavilion, Hyderabad. I would like to continue here itself. So in the last 5 years, I'm Yashoda. This is my brief intro. And today I'll be talking about something more pressing in the society, that is about cancer and its awareness. The moment we hear about cancer, everybody will be getting scared and nobody wants to listen anything about it. We are so emotional, more sentimental about it. Okay. So the thing is, there are so many wrong perceptions about cancer and its treatment. And as we are seeing, our lifestyle is changing a lot and we are moving across into fast-paced lifestyle, and we don't know what we are eating and we don't know how we are living and we don't know what kind of rat test we are going through. So I'd like to give you some key points which you have to keep in your mind so that you or your near and dear or your family members, if they have any kind of small warning signs regarding these cancers, you can always try to find them and come back to the hospitals, because cancer, it's the more of the myth is it's not curable, but the main thing is cancer is curable. Important thing is you have to find it in the early stage. That's very important. There's something called golden period. If you are getting in, almost every cancer is curable. The biggest problem is we don't come to the doctor until the later stages where even the doctor cannot do anything. So in this regard, I would like to put in very layman terms so that everybody can understand, remember that what kind of cancers can be indicated with what kind of symptoms and what exactly causes and what we can do to prevent the cancers. So what exactly is the cancer? It's nothing but our own body cells. They simply start dividing. You all know, you might be biotechnology students and professors, right? So all the cells have a pattern of growth. So they will grow at regular time period and they will stop growing after that. And also they will die with a programmed cell death. But when this continuation of proper program is lost, they have no timeline. They will rapidly grow. They keep on dividing. So one cell becomes hundreds, thousands, and lakhs. This lump of cells is nothing but cancer because it is not following a regular pattern of growth. And this can be of 3 types. Yeah, where is this? Okay, sorry. Yeah, if it is growing slow and it is not disturbing the surrounding tissues and it is only causing symptoms with its pressure, then we call them as the benign tumors. They are actually safe. They don't cause any bigger problems and they are not cancers. So you might be hearing a lot of people having the lumps. Sometimes they'll be having skin lumps or something. They keep on lipomas, and sometimes brain tumors are also there. They are not actually cancer. They grow very slowly. They only cause symptoms when they are trying to put some pressure on the surrounding tissues, and they are safe. They can be removed easily. The next one is the precancerous lesions. Sometimes people might be saying like they have some white patches on the tongues or in the cheeks. These are like the cells are undergoing some kind of mal architecture, but they're still trying to get under control by our immunity. If you leave them like that, in the long run, our immunity will also give up its hands and they will convert into cancers. So if you are able to find them early, you are again trying to prevent the cancers. The next stage is the invasive tumors, which are nothing but we commonly call as cancers. These rapidly grow. There is no control over them and our immunity will not detect them. They kind of develop some mechanisms to disguise from our immunity so that they cannot be killed. And they grow so much, they will also eat up the surrounding tissues and they start spreading across, and they can go to distant places also. That's why they are called malignant or invasive cancers. These are the ones which are concern for us, and these are the ones which needed urgent attention and treatments. So if you see Indian distribution, sorry, I am pressing the other button. Yeah. Incidence and mortality. Almost top 3 cancers in female: breast, cervix, as well as oral cancers. And even males, lung cancers, oral cavity cancers, and GI cancers. These are in high risk. And coming to lung cancers, compared to the previous decade, this decade is almost exponentially growing around 50% more. The reason is increased alcohol, increased smoking. Even that gender bias was there before, now that is also not there, because females are equally smoking like the males. That's what the trend is going on. So we are seeing a huge trend even in the female population. And so almost you can see from the graphs, breast and cervix are occupying around 30 to 40% of the cancers. And you can ask me, which parts are common for cancer? There is no limit. Any cell in the body can give rise to cancers. Top to bottom, head and neck cancers, brain cancers, lung cancers, GI cancer like pancreas, abdomen, liver, prostate, cervix, any part, any architectural DNA change or mutation can lead to cancer. So there is nothing like this is the only common cancer. Any part can give rise to cancers. So we'd like to go with most common cancers which we see and most pressing in the society. What are the common symptoms which we can see in this? So if you come to brain cancers, the most common thing they will get is frequent headaches. Sometimes they'll have vomiting sensations. They feel so heavy or dizziness, and also have, if it is occupying some kind of brain, you all know there are different areas which control separate functions of the body, like some control speech areas, some control talking areas, some control movements. So if it is in that certain locations, you will see the similar symptoms. Like some may have speech difficulties or weakness or sensory losses, or if it is memory part, you may see memory impairments. So based on its position, it will give some kind of symptoms. In common, they might give overall headaches, heaviness, and dizziness. These are the most common things. And when should you talk to the doctor? See, everybody who has headache, they'll simply say, I have migraine. That's a common thing we can see. Because if it is continuing for 1 week, 2 weeks, and 3 weeks, it is important to get it completely evaluated. The first and simplest thing you can see whether the structural problem is there or not, MRI. An MRI can rule out any kind of lesions, even it's a tumor or cancer, anything. Or it can also give you confirmation there is no structural problem. It might be functional, like migraine or something, stress headache or something. So don't hesitate to go for MRIs. They are actually safe. They don't have any radiation. If somebody is having prolonged headaches or vomiting sensations or even heaviness, some kind of abnormal CNS symptoms, it's better to rule it out with simple MRI. So the reason is, if you have detected anything in earlier stages, it's very easy to burst them with radiosurgery. Even they don't need even surgery or opening of the brain. Now we have techniques to directly melt them down inside itself and send single the procedures. It costs very less. And you are also saving the life, and they get completely cured. Coming to breast, the most common thing is nipple lump, nipple discharge, or they might be having a lump in the breast. And sometimes there might be skin changes, erythema or redness. Or sometimes what happens, there might be irregular positioning of the breast because of the tumor that might be dragging up or down. And they may have sometimes pain. Pain is very rare, it's not common. Most of the times, if it is associated with pain, it may not be a cancer. That can be rest assured, because fibroadenomas or fibrocystic changes, which are non-cancers, they might give a lot of pain. Tumors, most of the time, they don't give any pain. Or skin irritation, dimpling, like they will be forming some spots which are like a pits. Or sometimes there might be swelling in the armpits. If you see any of these symptoms, it is important to have a self-examination if you know, or you go to the doctor to get it checked whether there are any signs of breast cancer. And the simplest thing we can do is mammograms. They can directly rule out whether there is any lump developing into cancer or simply a safe fibroadenomas. Don't panic if you're finding any lump, because 90% of them are fibroadenomas, which we are seeing in the last 15 years of practice. Only 10% has a chance of being cancers. But whatever it is, we don't want to leave the 10%, because if you leave it at the early stage, it may go into advanced stage, the treatments will be horrible. Coming to cervical cancers, another most common cancer among the female population, especially we see much of it in the rural population than in the urban. The main reasons being hygiene is one thing, multiple sexual partners is one thing, and the other is HPV associated viruses. These viruses are the cause. Almost 80 to 90% of the cervical cancer caused by HPV viruses. And now we have this cervical cancer vaccine. This is the only cancer which can be prevented with vaccine. And now we are happy that has been included completely in the immunization schedule for the children. From 9 years of age until 23 years of age, both boys and girls can take this vaccine. And people who are above this age can also take up to 45 years of age. But 9 to 23 is 100% guaranteed. But above that, if they are not exposed to this HPV virus, still they will have the same kind of protection. So until 45 years, we are offering for everyone. And this one thing, it is in your hands, you can prevent it and can forget about this cancer for life. Coming to colorectal cancer, that is intestinal cancers. The most common cause for it is fast foods. The method of preparing fast foods itself is totally different. You are using the same kind of iron pans, and you will be, if you see the way they prepare it, they keep on scratching it, right? The way they prepare, and the same kind of oil multiple times they use, they kind of provide development of some carcinogens in that metallic conversions. So these, when they mix in your food, they are definitely trying to cause reactions in the intestines. And if this is continued for longer period and immunity is not so good to cover the DNA damages, then they develop colon cancers. And that's the reason, can you guess which country has the highest amount of incidence in colon cancers? Anybody? Who eats the most fast foods? China and Japan. Japan is number one. So they have done an interesting experiment regarding this. They have a Japanese colony in the US. When they shifted there, until then there are no colon cancer incidents in USA. Suddenly, after 10 years, they started seeing colon cancer rise, and they found out that the Japanese colony is getting this one because they are having the staple food with fast foods itself. So it's a primary thing. If you are eating, it's not that you should not eat. Be careful, don't eat it frequently. Or you also take care where you are eating, how they are preparing. That's more important. Or prepare safely at home. That's more important. It's not that you should completely avoid it. Anything will affect when your genetic vulnerability is there and you are exposing that damage for a longer period of time. Because if it is short period and you are not giving it exposure again, our body can heal it. If you are not giving that time to heal it, it cannot do anything and the cancer will take over. Coming to prostate cancers, this is the most common cancers among the elderly male. And regarding this, I can say it's a good cancer because it doesn't kill the person. It comes around 60 plus. And even if it is there, he is not taking any treatment, still it doesn't harm the person so fast. It grows very slowly. And even more beautiful thing is the treatments are so good. Initially, the surgery is the mainstay of treatment to remove the prostate. Now, radiosurgery is there. We can do within 5 days of radiation, the prostate cancer completely gone. No need of going through invasive surgeries. And even they can avoid erectile dysfunctions or urinary incontinence, which are the common complications of the surgery. And if they are like more advanced, we try to control with hormone therapy also. They are also giving very long-term control. Even 80 years, 90 years, people don't die with prostate cancer. So if somebody is getting this, no need to worry. They can simply get this treatment and they can forget it about. Coming to lung cancer, and we all know how movies picturize a cancer patient. The moment they have lung cancer, they will cough up all the blood and they will die on the floor. And I have never seen a patient in 15 years, a patient dying like that because of lung cancer. In fact, patient has to come to you and say he has lung cancer. Until that, you don't even recognize. So the amount of emotional trauma the movies put on us is very much. People scared to come to the doctors. So thing is, the most common thing they will get is cough, or sometimes they don't have any symptoms initially. Whenever they go for health checkups, suddenly they have long history of smoking, like 10 years, 20 years, taking 1-2 packs every day. Suddenly we can see some lesions. Still, they don't have any symptoms. Only thing, when it starts growing bigger and it starts damaging the surrounding tissues and blocking the airways, then they will start having the symptoms of cough, or sometimes blood-stained cough. Only stain, doesn't cough so much. And sometimes in the area where it is, you may have chest pain. If it is touching the ribs or skin, if it is going more advanced, then that area definitely he will have pain. Otherwise, they don't have any other symptoms. So if it is growing into distant mets, like it is going into bones or brain, then they will show distant part. Wherever it is going, that part also shows some kind of symptoms like bone pains, like lower backaches and all. Even prostate, most people come with lower backache, then we go to evaluation, that comes down to prostate. So until that time, people don't even check up their symptoms. So this awareness is very much important for that. And lung cancer, these are the symptoms. So we'll see what are the root causes of cancer. So you can see the big chart, there are so many contributors. Some may be direct, some may be indirect. Whatever you can see, diabetes, sedentary lifestyle, obesity, weakened immunity, poor diet, nutrition deficit, all will come down to oxidative stress, genetic vulnerabilities, which once they are not repaired, the programmed cell growth will be abruptly, disrupted, and they will go into rapid division phase that becomes cancer. And coming to the hazards from the environment, you have environmental toxins, especially in the occupational hazards, asbestos, cement factories, coal factories, wherever there are micro dust, there is always a chance they might be inhaling, or sometimes they will be constantly exposed to the skin, or some people directly get inhaled or in the food. These people might be having chances of getting liver cancers, prostate cancers, skin cancers, or through inhalation, they might be having nasopharyngeal cancers also. So you should know which are the risk factors surrounding you. Based on that, what cancers you are at risk, and if you are able to prevent that factors, or if you are able to go for screening regularly regarding that, you will be always away from these dangerous things. So these we can divide into modifiable and non-modifiable risk factors. Why? Because some are not under our control. Some are under our control. So if you see age is one factor, genetic composition, or already some people having genetic risk from their parents, inheritance, familial, and the other things is some kind of risk factors which are already in the body. These are non-modifiable. Modifiable risk factors which we acquire due to our living, our habits, and our exposure. These are in our control, which we can control or prevent, then we can prevent so many cancers. So these are the risk factors which we can divide into 3 parts. One is biomedical. They have genetic susceptibility. Most common things are breast, ovaries, and bowel cancer, is colon cancers. Some people might have syndromes like Lynch syndrome, etc. They have one common kind of mutation which can lead to multiple cancers. So like this, now we are happy, or we can be advantaged because we have genetic testing available, especially the next generation sequencing, which can test for 120 types of cancer genes in a single blood sample. If you can do that, you will be knowing what kind of cancers you are at risk, or your offspring, or your parents, whoever it is there. If somebody has cancers in their family, they can get a counseling and they can get this predict advance. That's what we call it. So it can predict whether you are at risk of any kind of cancers. So that will help us even to start screening early for the type of cancer, so that if something is there, you can remove it immediately. And coming to hormone factors, this is more important females, because breast cancers, ovarian cancers, endometrium, all 3 are linked with estrogen and progesterone cycles. The more amount of estrogen exposure is there, the more the risk of having breast cancer or ovarian cancers. So that's the reason, one thing, if you see people of breast cancer, the risk factors are late marriages, late children, and early menarche, or or late menopause. The reason is you are increasing the cycle of estrogen in your lifespan. The more number of estrogen cycles, the more exposure to estrogen. The moment people have children, the progesterone takes domination and estrogen comes down. And progesterone is a protective factor against the breast cancer. That's why you will always encourage breastfeeding because it keeps on stimulating the progesterone hormone. And the more it is increased, the risk which has been developed because of the estrogen will be completely vanished off. If you and we all know these days so many lifestyle changes, occupational stress, and work-related marriages are getting delayed. Having children is getting delayed, and even after that, because of work-life stress, we are not able to breastfeed. We are much relying on the artificial feeds. The reason for increasing breast cancers in the cities is this is the major cause. So if you remember this, and if you are able to give priority to this, you are almost reducing the breast cancers incidence. Coming to lifestyle factors, you all know smoking, one of the major factor. Almost with smoking, you can get 11 types of cancers. The major being lung, stomach, pancreas, liver. Even nowadays, even cervix is also linked for it, and blood cancers. Simply imagine the amount of smoke inhaling. Nasal cavity, pharynx, larynx, coming to lungs. It can also go through the food pipe into the stomach and until the rectum. All these parts which are chronically exposed can get cancers. Coming to alcohol, even breast cancer is linked to alcohol now. Liver, colon cancers, esophagus, pharynx, oral cavity. All these areas can come under extreme oxidative stress and mucosal damage that leads to cancers. Physical inactivity and obesity, both are interlinked. The amount of obesity, it increases, your insulin resistance increases. The insulin resistance, once it increases, your immunity power decreases. And the immunity power is very much important because it has the factors or the enzymes which keep on constantly checking the DNA damages. And oxidative stress directly damages the DNA. And at the same time, you are not having proper repairing mechanisms going on because of the insulin resistance. It is a double-edged sword. Both will contribute aggressively to development of cancers. And chronic infections, especially cervix, liver, even in buccal mucosa or oral cavity, if they are continuously there, the virus keeps on irritating the tissue, and slowly the normal tissues change into neoplastic cells or in situ cells or precancers, then they will continue to become cancerous cells. So the cervix is the most common example for that. Diet, as we have discussed, how the diet changes complete architecture. So commonly affected are colon cancers, breast and prostate. Occupational, environmental, sunlight for skin, and fortunately we have a lot of pollution to cover us from sunlight. So the incidence of skin cancer less in India. And if you go to US, the sky is so clear, you feel like they are needling on your skin. Even if it is 30 degrees, you feel like you are having pricking pain with the sunlight. So that's why skin cancer incidence is much more in the Western countries compared to India. And other way, pollution is protecting here, but it is causing lung cancers. This is another different way. Coming to radiation, leukemia, blood cancers, breast cancers, thyroid cancers. These are most common with it because they are very sensitive to this exposure. Occupational exposure, we have discussed all the industries, cement, coal, silicon, chemicals like aromatic compounds production, and these things. One more thing I can say, some people keep on asking, like if they apply hair dye, will they get cancers or nail paints? Or the person who is applying the hair dye, he may get cancer. Thing is, if you are doing it regularly and how much exposure you are giving and what kind of chemicals you are using in the dyes. So some which are very cheap, they try to produce using all aromatic compounds at the base level, which have so many toxins, definitely you are at risk. And more than the person who is getting it, the person who is doing it is at the higher risk because he is constant touching with it every day and all the days. And other thing is pollution. We have discussed skin cancers in other way, not the sunlight, and lung cancers and bladder cancers. So if you see this risk factor chart, tobacco and diet almost targeting around 60% of cancers, and both of them are in our hands If we control them, we are avoiding 60% of the cancers. So what can we do? How to prevent? These are all the modified risk factors. If whatever we do directly impacts our risk for cancers. Tobacco, avoid tobacco chewing or tobacco smoking. Body fat, decrease it. UV radiation, prevent yourself from higher exposure of UV radiation, either by avoiding direct sunlight or applying SPF 15 or 30 plus creams. Physical inactivity, try to avoid it. Be fit so that your immunity works well. Decrease salt consumption. This may indirectly affect in multiple ways, also linked to obesity and your circulations. Alcohol, control it. Human papillomavirus, try to avoid multiple sexual partners, try to avoid without protection, and also try to get the cervical cancer vaccine. This is the most important thing. And these are all preventable. Coming to processed meats, one thing is more important. The way the market is producing the processed meats, they are trying to attract you by visual appearance. They want to produce fluffy things. They will inject some kind of chemicals. And also the color, they will try to make, all the colors are having toxinogenic dyes these days. If you see that red dye or yellow dye, what they mention, they all are linked to cancers. And the other thing is processed meats have a lot of red meat, especially have a lot of toxinogenic components. So if you want, try to reduce or avoid red meat. The other meats is fine, but processed or red meat, it is better to decrease the consumption. Ionizing radiation, they cause hazards. Try to be always away from them. And oral contraceptives. Sometimes it is protective, sometimes it is hazardous. Oral contraceptives, try to control your estrogen production. And if you are taking single agent OC pills, that is dangerous. Like some in olden days, you used to get only estrogen only pills. That is a higher risk for breast cancers. Then the people change it to combined or progesterone only pills. They are protective against breast cancers. Breastfeeding, it is protective. Encourage it. And H. pylori infection, this is one thing we always neglect. People try to say, I have acidity, I have gas, and they keep on taking the famous gas goli, pan tablet, right? And I have patients, even when I was in army also, they get a lot of free medicine. They keep on taking every month, lot of antacids. And finally, after 10 years, they are ending up with gastric cancers. So even taking antacid tablets for long is also very dangerous. They will destroy your stomach mucosa. They will produce atrophic gastritis that leads to gastric cancer. So use only when it is really required. Don't take it just for the sake of taking it, you will be prevented. But long run, what happens, your mind psychologist thinks starting, like only if I take it, I will not have acidity. So you should come out of it. I have a recent, last 2 years, I have a patient. She is taking from 5 years, same pan tablet. And we have seen multiple polyps developed in the stomach and duodenum. We strictly said stop complete antacids, and we have given smoothening, what do you call? There are sucralfate. This is very important to reduce the inflammations. Now, after 1 year, now the complete polyps are gone. If we leave like that, in next 1 to 2 years, she will develop gastric cancer. So because she came early, we stopped her, we gave the things which can smoothen her gut. Now she is completely prevented from gastric cancer. And gastric cancer is one of the worst cancers. If you don't treat 9 months, patient will expire. Such aggressive cancers. And the reason for most of the people is H. pylori infection. This is a Helicobacter pylori infection. If it is in your gut, it keeps on irritating the mucosa and destroys the mucosa and creates atrophic gastritis. And from there, automatically, whenever the acid touches it, the ulcer begins to start and develops into cancer. So if you have H. pylori infection, you almost, there is nice antibiotic regimen for 2 weeks and you can eradicate the H. pylori. So whenever you have this rapid blood test for this when endoscopy, if it is positive, immediately start that and you will be avoiding cancer, and also acidity will not be there. Most people keep on thinking they have acidity, but they will never get an endoscope done. This is the most common cause for acidity. Hepatitis B and C infections, most common cause for liver infections. Hepatitis B, we have vaccination. So everybody take all the 3 doses of vaccination. Also take every 5 years on booster, so that you will be always protected from the hepatitis B. It's very notorious. It can lead to liver cancer. C, vaccine still under development. Maybe 1 or 2 years it will come into market also. And that is also one of the dangerous things that cause liver cancers. So how do we prevent? If you can see the graph, almost smoking, obesity, alcohol. Here only you are having almost 30 to 40%. If you stop this, you will be saving from so many cancers. 50% of cancer preventable just with preventing smoking, avoiding alcohol, and protecting your skin. And cervical cancer, you can come 100% prevent with cervical cancer vaccine. Skin cancers, as we have said, you have preventive measures. Colon cancers, diet, very important. Lung cancers, protection with prevention of smoking as pollution now. It is almost as equal as smoking. Breast cancer, get screened from 30 years, or everybody should learn how to do a self-breast examination. That's very important. And if you are able to do that clearly, you can come to any doctor if you find a small lump and get it checked whether it is a cancer or not. And one thing to remember is don't panic if you find anything. Every time we see some people get anxiety and they keep on checking every day. That's not required at all. Once in a month is enough. So this is a simple chart. If you follow this, 99%, you will be preventing around 60 to 70 types of cancers. So be at healthy weight, be physically active, eat diet rich in whole grains, vegetables, and antioxidants. Antioxidants help us scavenge all the oxidative stress we are developing with our food. And consumption of fast food, processed meat should be decreased as much as possible, as the same as the sweetened beverages. Coming to processed meat, as much as possible, avoid red meat, limit alcohol. Supplements for cancer prevention, this is another big myth. People keep on giving you so many things in Amazon or somewhere. If you take these pills, you will be prevented from cancer. There is no such drug. There is no such drug. Only you can do is have healthy antioxidants in your diet, or if you have some pills of that vitamins, that's fine. Other than that, nothing else is true. And mothers encourage breastfeeding. That's very, very important. And if you have small suspicion, immediately contact your doctor. That's more important. So if you can see, only with exercise, you can prevent all these cancers. So stay active. Colon cancer, stomach cancer, esophageal, bladder, kidney, endometrial, breast. Just by being physically active, you'll be staying away from all these cancers. And these are the screening tests which we have at regular ages, like starting from 30 years. Mammography every 2 years. If you have smoking history, go for a low-dose CT scan every 1 or 2 years. And endoscopy once in 5 to 10 years is enough. You will be knowing all the esophagus, gut, colon, rectum. And if nothing is there, you are rest assured next 10 years, you are not getting anything. So once in 10 years, this test is enough. Prostate cancer, simple blood test with PSA. For the elderly age people, they can simply know whether there is any prostate cancer or not. There are also some blood tests for tumor markers of liver, pancreas, ovaries. Once in a while, if you check, is also enough. So you'll be totally knowing whether you are at risk of them or not. So we have advanced treatments available now. Robotic surgery, you don't need to open up the body so much. Pinhole surgery is what we call. You just put up some pinholes, you are doing complete surgery and you are coming out. Next day, you can get discharged from that thing. You don't need to have any sutures also. That kind of developments we have. And coming to radiation therapy, we have advanced therapies, radiation with true beams, MRI guided and proton guided. And now we are able to sync the movement of the body to give radiation. Whatever breathing exercise, we can see the radiation beams exactly following breathing pattern and exactly hitting the tumors. And stereotactic radiosurgery is one more advanced thing, precisely hitting the target without affecting any surrounding tissues at the submillimetric levels. So patient doesn't even know whether they are undergoing any treatment. It's like a simply scan. Patient will be lying on the radiation machine. Within 5 minutes, he will get up. He doesn't even know what's going on. Such sophisticated treatments are available now. Nothing to worry about treatment. Some people will be scared. We have to go through long treatments or something. Once they get to know this, they're very simple. They'll be happy to get the treatments. And now we are into target therapies, specific mutations, specific genetic abnormalities we are finding and identifying, and we are developing tablets for the simple. Even lung cancer at stage 4. Initially, they used to live for 9 months. Now with target therapies, they are still maintaining after 5 years. They are not undergoing any chemotherapy, any surgery and radiation. Specifically with the simple tablets of target therapy, they are maintaining complete health. And that's it. Early detection saves lives. This is a simple mantra you have to remember and stay active. Thank you. If you have any queries, I'll be happy to answer them.
The Gardasil injection which we give for the
Cervical cancer. Yeah. Hmm.
It's a mandatory or it's a preventive?
See, now in immunization schedule, it has been mandatorily kept it. 9 years, you start from 9 years. If they are younger, 2 doses are enough, 9 to 13. If they are at a higher age group, we suggest taking 3 doses. And it's now in schedule, so it's mandatory. Even if you know or not, your children will automatically getting it.
Side effects, right?
No side effects. It's
Even
completely safe.
teenager.
Yeah. Anybody, even until 40 years, 45 years also, anybody can take now. Only thing is at the site for half an hour, they may have severe pain. Other than that, nothing else is there.
It's from a family history also the symptoms, sir. Oncology.
I didn't get you.
Cancer.
Family history.
Like with the parents or a grandparents. or-
See, if family history you have some kind of cancer, the age is the most important thing. If they are getting cancer above 60 years, we don't consider it as hereditary. Below 60 years, if they are developing cancers, definitely there might be some component of hereditary. Then for that particular type of cancer, you can start screening from 10 years earlier than the age what your parents got it, parents or relatives. So as an example, 50 years, somebody got some kind of cancer. You start screening from 40 years itself for the same cancer. So by that way, you'll get to know when early it is starting in your body and how can you prevent it with the earliest stage if it is started to develop. You can see the symptoms or signs inside the body, you can immediately prevent it.
I have a question here.
Yes. Yes. Okay.
Fantastic presentation. Thank you
you.
so much for that. So last month, there was a news that UK NHS, National Health Service, was actually implementing this monoclonal antibody, I believe, nivolumab or something, which is used,
Dostarlimab? Yeah.
probably for all the cancers. Is that?
No, see, that is more of misconception from our proactive media. It is actually being tried with the rectal cancer, that too stage 1, very early. That too, they have a specific kind of mutation, MSH mutation. Only in the people who have this mutation, that is working. So they didn't undergo any radiation or surgery. They have given 6 months of this time and completely it's vanished. And now they are still under follow-up, whether to see if it is coming back or not. And if it is successful for the next 3 years, they are not coming. They are trying to expand it to advanced stages of the same, or who have this MSH mutation. Yeah, like most of the times we can see this in the colon cancers or stomach or in the rectal. These areas we can see this kind of mutations. In that cases, we can try to expand it. And it is not a blanket therapy for all the cancers. It doesn't work. And that too, now it is early. It is working. We have to do trials on the advanced stages and see. As of now, the gold standard still is give radiation. If it is completely gone, you will wait and watch, or you have to undergo surgery followed by chemotherapy. This is the gold standard. Only for precise early stage, we are offering it. If it is still after the 6 cycles, still we see something, again, they have to go to the same kind of treatment.
For the lung cancer, you were talking about some tablets with which you were able to maintain the patients. So
Yes.
are these tablets also monoclonal antibodies?
Yes. See, some are monoclonal antibodies, some are specifically target therapies like tyrosine kinase inhibitors, TKIs, and some are T790M mutation holders. Some are CD4, CD5 inhibitors. So there are multiple classes in that. So you might be hearing lenvatinib, geftinib. These are very famously coming in media also. You just take one tablet, you'll be preventing lung cancer, something like that. Geftinib is much more being published like that. So in that case, we see for 3 to 4 more common mutations are there, especially who are non-smokers. And we are seeing this trend in females who non-smokers coming around 40 to 50 years of age. Most of them are having these mutations are positive. They are ALK, RAS, BRAF. These 3 are very common. They have very good medicines. And most popular among them is now osimertinib. Initially, we used to give geftinib, lenvatinib. Then if they have resistance, we used to go for osimertinib. Now, if you are starting with osimertinib, even they don't have resistance for this, you continue for 3 years, you don't see any progression in the disease. I will tell you, I have a patient, complete body spread with lung cancer. See, in that case, you cannot do any surgeries, lung chemotherapies or chemotherapy can only control 20%, but can extend up to 1 year. After that, it can also be difficult to control with that. This osimertinib, within 3 months, the PET CT is completely clear. The whole body, there are no active disease. And I'm still continuing them for the last 3 years, still they don't have any active disease.
But no
Thing
other
is, they
side
should not
effects.
miss the tablets.
Okay, there are no side effects from the
Side effects for immunotherapy strategies very, very less compared to chemotherapies. Like they have more of allergic reactions or dry skins. Sometimes they have tingling sensations. Sometimes they have some kind of heat in the body. This kind of constitutional symptoms, they can be manageable. Chemotherapy will have a lot of other things like the body weight loss or vomiting sensations. They have huge other types of things which patient you see they may become weaker, but these are not causing any such type thing. It's superficial.
Thank you.
So thank you. Thank you for breaking a lot of myths on cancers.
Thank you.
So I have one question regarding the sunlight exposure. In the one end, we say that we are lacking vitamin D, we need to expose to sun. In the other end, we are being asked to have sunscreen. And recently, there are also a lot of social media Insta stuff that's going on against sunscreens.
Yes.
So how do we?
I'm saying about somebody asked this question.
Yeah, because how do we go by how much of sun is required and how do we actually
see here we have to understand the concept of vitamin D. What kind of sun exposure will give vitamin D? The early sun rays before 9 o'clock. You have limited UV rays coming out. You have normal sun rays which stimulate. They are like in the phototherapy range. So 450 nanometers in that range, they will stimulate the skin cells. And the stimulation of the skin cell produces D vitamin in our body. The moment you are crossing 9 o'clock or 10 o'clock, the rays are so severe, they are sending UV rays at that time. So they are crossing the ozone, they are coming into it. Until then, they are so mild, what we are receiving the light, it is milder, it is helpful. And from that time till afternoon, it is always harmful. If you try to expose for vitamin D in the afternoon, you are ending with different thing, not the vitamin D. So the timing is very important for this. And the second thing, recently we are seeing so many people talking about SPF 15, 30, whatever skin you are getting, you will have cancer from this. See, to some kind, it is true. To some kind, it's not true. If you see one type of, Insta has this algorithm, whatever you see, it will keep on saying the same thing again and again until it brainwashes you. That algorithm is there. If you see some kind of real estate today, next continuous 10-15%, everything will be real estate only. So, and one person talks, all the people, whatever it is, it will come to you. You think everybody is suddenly talking about it now. So it's like a brain game. We should also see whether what we are doing it. And skin protection, one person produces one kind, everybody wants money. So 100 companies crop up. So it is our duty to see which is genuine, first thing. Second, it is not required every time. And how much we are exposed to sun is really, really less. In our country, the moment we get up, we are coming into AC offices, we are going into houses. And vitamin D deficiency is much more than compared to exposure to sunlight. And this is one more reason we are not getting skin cancers much. And if you see Africa, I see a lot of patients from Africa coming here with skin cancers, squamous cell carcinoma on the backs, and they are so lazy. I see they have 15 centimeters of skin cancer, still they are simply searching for, okay, we'll come after 3 months, we'll come after 6 months. And I don't know how they are not even panicking with such kind of victims, which we cannot even operate. So the kind of mindset also matters there. And sunlight, avoid in the midday, that's more important. Get sunlight in the early morning, that's fine. That doesn't mean you have to get up every day at 6 o'clock. Whatever before 9 is enough. Second thing, if we are working in ACs and all, definitely take vitamin D supplements. That's more important. And vitamin D is not just for bones. It is linked to so many things. And now deeper research produces, even it is linked to heart attacks, vitamin D deficiency. So people keep on asking, sir, I don't have any habits, or I don't have alcohol, I don't have smoking. Why I'm getting heart attacks? The reason is vitamin D deficiency. And it is linked with some kind of alpha lipoA and other antioxidants, which deficiency is there. Sometimes there is homocysteine levels. They are minute things, but these are important when people who doesn't have any risk factors. So vitamin D, and also if you see children who are not given vitamin D properly, they'll have a lot of cough, cold, routine allergies. If you start giving proper vitamin D for those kids until 5 years, you will not see all these things. Your immunity is so strong. First of all, that virus is also not coming, and they don't require to go to have such a amount of allergic exposures. So vitamin D, definitely whoever is not exposed to sunlight, please take it weekly once, either as liquid or tablets, chewable tablets. You get it, at least take 3 months, at least in a year. That is enough. 60,000 units, high amount. Or even if you don't want, we have some injection that will cover for the whole year. Arachital injection, 6 lakhs units. Okay. I tell my own experience. I was so happy here when I was in Usmania and all. We are running around the city with on bikes to all 14 hospitals. Suddenly I went to US. My work is completely inside. I used to see sunlight only in the weekends. I was in Sloan Kettering Cancer Center. 6 o'clock I'll be in the operating room. 9 o'clock I'll come out. No lunch, nothing. Cranberry juice or coffee. Go back to surgeries, robotic surgeries. 2009 is the situation. And suddenly after 3 months, I had one day I'm hurrying to run. I started having shin pain. I never had this before. So slowly I understood vitamin D is lacking there because I'm not seeing the sunlight at all. So vitamin D slowly affects, we don't even recognize it. So always, if you are not exposed, better take these supplements. They will not harm you. And it is, be careful, don't take continuously for not more than 3 months. If you are going for 1 year, again hypervitaminosis will come. Take 3 months in a schedule, stop it. That's enough. You will have storage for the next 1 year. If there are any absorption problems, then if it is still deficient, then go for direct injections. That is fine. Or some people might be having calcium with daily required amount of vitamin D tablets in B complex. If you are taking regularly, it's fine, but not needed for everyone. And B complex, everybody not need to take all the time. If you take too much of medicines, you all know biotechnology, you always knowing, they'll put a lot of other ingredients surrounding the medicine. It's only 1 gram or 1 mg. You will put some 100 grams or 10 grams something of extra ingredients. They will cause some kind of toxin effects. So better to reduce the amount of medicines you take. Take longer ones, which like 60K units you take once, that is enough. The same amount of ingredients will be there. If you take daily, you are adding more of the other ingredients. So smartly you can plan like that. Yeah. If I wait more, they will hit me. Okay. Thank you so much.
Thank you so much for coming, really. I had some other meeting going on. So I said, give me 20 minutes in the name of lunch break, so I do meet the people who are going here. Look at the less medicine, don't take medicine.
One more thing people don't agree with me, but you are so comfortable with it happening. People always find it wrong, but the common thing is our brain is tuned to a regular cycle. It will release the acid at the same time. In this one time, you will already have the acid. So if you show your mind by producing, having put it irregular time, it will never give you acid until you put the time. That is more important. So trading or training is more important.
So,